million people who live in Mecklenburg County. I am participating remotely in our meeting tonight. Welcome.
Commissioner District 1.
Hello, this is Commissioner Elaine Powell. I represent District 1, which includes Huntersville, Davidson, Cornelius, and North Charlotte. And I also serve as Vice Chair, and I am participating remotely.
Commissioner District 2.
This is Commissioner Vilma D. Leek. I represent the most powerful district in the county, and that is District 2. And to all of the citizens of Mecklenburg County, pray that all is well.
Commissioner District 4.
Good evening, everyone. My name is Mark Jarrell, and I've been elected by the people of District 4 to represent them on this board. And I want to say thank you for joining us tonight.
The Commissioner of District 5 has a duty right now. She serves as the chairperson of the Transportation Committee, and she will be joining us late. District 6, Commissioner.
Good evening. This is Susan Rodriguez McDowell, and I represent District 6, and I am participating remotely.
For the record, all commissioners have acknowledged their presence for the meeting. Therefore, we have a quorum. I will at this time ask the following persons to introduce themselves. Clerk to the board.
Good evening, Emily Kunze, clerk to the board.
Deputy clerk.
Good evening, I'm Christine Smith, deputy clerk.
County manager.
Good evening, I'm Dina DiOrio, Mecklenburg County manager.
And our county attorney.
Good evening, Tyrone Wade, county attorney.
Thank you. I want to share with the commissioners that the commissioners' report has been moved to the end of the agenda. Please note that this is the section for commissioners to make comments and to share information on items not appearing on the agenda. Each commissioner will be limited in their comments. To avoid potential open meeting violations, commissioners should refrain from making motions or suggesting any action be taken during this section. If you have an item you wish to be considered by the board, it should be submitted consistent with the established agenda policies. And of course, that requires to get 2 other persons to sign to add that item to the agenda. Before we turn to our housekeeping rules for the meeting, let me first have our invocation. Tonight's invocation is offered by Commissioner Mark Jarrell of District 4, followed by the Pledge of Allegiance. Now, if you choose, you may bow your head or to hear the invocation.
Thank you, Mr. Chairman. Good evening again, everyone. Tonight, our invocation, I'm going to share some reflections and just some thoughts. And as I was preparing for tonight's station, I had the opportunity to reflect on how this situation has really highlighted and in certain instances exacerbated the inequities and disparate outcomes experienced by so many in our community. And I've also had the opportunity to reflect on the many emails I've received from concerned citizens around the need to reopen our economy and get back to business as usual. And you know, some of the correspondence, it's been striking, and others, it's been extremely telling to a degree, and particularly about the mindset of some of our residents who have reminded me about the inconveniences they've faced over the last 7 or so weeks. I've heard about the inability to enjoy their favorite bars and restaurants and experience their normal extracurricular activities. And it's understandable that this has been an extremely difficult time, and it's taken a tremendous toll on so many, which has certainly been expressed in no uncertain terms. And tonight, it's my sincere desire, in fact, it's my prayer that some of these same people that have contacted me and contacted my fellow board members and colleagues will leave this situation with a new perspective and a new lens, particularly as it relates to those who have experienced these same conditions and worse for their entire lives. I hope that they have a new empathy and display this same level of passion for those born into and whose experiences and level of discomfort are counted not by weeks, but by generations. And now that we've all had a taste of the plight of so many in our community, I pray that there's a newfound respect for the socioeconomically disadvantaged, and that the same passion and anger is channeled to organize these email campaigns on behalf of our most vulnerable. Too many in our community have been born into conditions of inequity and lack. They're forced to live with the lack of opportunity, access to quality health care, employment, education, recreation, stability, and overall quality of life. Instead of a favorite restaurant, they live in areas of food insecurity. Instead of healthy options, they have to deal with lead in the water. Instead of access to quality health care, they use the emergency room as a primary care physician. They have underlying health conditions that place them at greater risk during these crises. And when people say we want business as usual, their outcomes are not considered, in most cases disregarded and ignored. So as we go back to business as usual, and we will, I pray that there's a newfound respect for our brothers and sisters who continue to survive despite obstacles. I pray that there'll be an appreciation for the spirit to go on in spite of unfair conditions, inequity, and injustice. And I pray that there'll be a compassion that mobilizes the same forces to work on behalf of those who don't have access, power, or privilege. My desire, indeed my prayer, is that we will go beyond business as usual, because we're better than that. My prayer is that we will have a renewed commitment to not settle for the status quo and offer bold policy and actions that do more than chip away at the margins and offer less than what our residents deserve. My desire, and indeed my prayer, is that there will be an intentionality around dismantling the institutional and systemic structures that have for too long created barriers for too many. That is my prayer. Amen.
Would you join me in the Pledge of Allegiance? And please mute at the time. I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So there's a couple of items of housekeeping business that we have to go through because of the circumstance that we find ourselves in. So if you would, I'd read those at this time. Since we're still conducting remote meetings, there are a few rules that govern our actions so that our board minutes are accurate. This must be an orderly meeting, and it must run smoothly. If a commissioner wishes to lead the meeting, please ask for a point of personal privilege. State the privilege so that the minutes capture the actions and the attendance of each board member. When the commissioner returns, please announce your return when convenient to do so. Since no one is physically present, when a matter is on the floor for debate, I will have to call on each commissioner and ask whether or not you have comments. Please wait to be recognized by the chair before speaking, and please refrain from speaking over one another or interrupting someone else's speech. May I suggest that each speaker ends comments by saying, "This concludes my comments." If a commissioner does not have any comments, please state, "I have no comments," or "I do not wish to speak on this matter." When a motion is made, please state your name, and if you are the seconder of the motion, please state your name as well. The chair will verbally repeat the mover and the seconder and the motion for the records. Since we cannot see one another, when there is a matter requiring a vote, I must conduct a roll call vote. I will call upon each commissioner separately to ask for the vote to be cast verbally so that there is no confusion as to how a commissioner voted. At the end of the roll call vote, the clerk will state the results of each vote. So let us begin by announcing items that have been pulled from the consent agenda for the comments, questions, and clarity are separate vote. Item 6063 was pulled by Commissioner Mark Jarrell, support name change. Item 6064 pulled by Commissioner Leak, public auction for disposal of surplus equipment. Item 6072 pulled by Commissioner Leak, temporary construction easement. Item 6073 pulled by Commissioner Leak, land donation. Item 6076 pulled by Commissioner Leak, easement donation. Item 6090 pulled by Commissioner Leak, grant application. Item 6092 pulled by Commissioner Leak, budget amendment. Are there any other items that need to be moved from the consent agenda at this time? All right, let's move to our first item on the agenda under awards and recognition. This item is a proclamation honoring the heroes and the victims of the UNC Charlotte mass shooting. It says, proclamation recognizing the one-year anniversary of a day of remembrance of the heroes and victims of the UNC Charlotte mass shooting and committing to a plan of action to address gun violence in our community. Whereas on April 30th, 2019, the people of Mecklenburg County were shocked and saddened by the mass shooting that occurred at the University of North Carolina at Charlotte, resulting in the tragic deaths of 2 students and the injuries of 4 more during the last week of classes. And whereas the lives of students Riley Howell and Ellis Reed Perler were taken from us far too soon, and the injuries suffered by students Sean DeHart, Drew Prosecco, Emily and Ramir Arahanda were too much to bear. And whereas the extraordinary heroism of Riley Howell and the quick action by campus police and the Charlotte-Mecklenburg Police Department surely prevented further tragedy and saved lives. And whereas April the 30th, 2020 marks 1 year since this horrific attack. And whereas so far this year, there have been 83 mass shootings, according to the Gun Violence Archive. And whereas the prevalence of gun violence presents a threat to public health, a matter that is squarely within the scope of responsibility of county government. Now, therefore, be it resolved that the Mecklenburg Board of County Commissioners do hereby proclaim April 30th, 2020 as the 1 year anniversary of a day of remembrance in Mecklenburg County to honor and recognize the heroes and the victims of the 2019 UNC Charlotte mass shooting, to recognize the spirit and resilience of the community, and to allow residents and students to pay tribute to the people who were lost during this tragedy and bring awareness to gun violence in our community. And be it further resolved that the Mecklenburg Board of County Commissioners does hereby affirm its commitment to developing and implementing a plan of action to address gun violence in our community, adopted this 22nd day of April 2020, signed George Dunlap, Chairman. Is there a motion to accept the proclamation?
So moved, Commissioner Dunlap. This is Commissioner Elaine Powell.
I second. This is Commissioner Rodriguez McDowell.
Okay, the motion was made by Commissioner Elaine Powell and seconded by Commissioner Susan Rodriguez McDowell. At this time, I will conduct the roll call vote. Commissioner Cotham, how do you vote?
I vote aye.
Commissioner Fuller?
Aye.
Commissioner Harden? Oh, I'm sorry, she is not here right now. She'll be in later. Commissioner Jarrell?
I vote aye.
Commissioner Leek?
Aye.
Commissioner Powell?
Aye.
Commissioner Susan Rodriguez McDowell?
Aye.
Commissioner Scarborough?
Aye.
And the chair votes aye. So at this time, we will yield to the Chancellor, Phil Dubois, for comments. Welcome.
Thank you, Mr. Chairman. Am I coming through?
Yes, you are.
Thank you. Well, members of the board and County Manager Diorio, we want to thank you for all of your efforts to protect the health and well-being of our community in these very tough times. I know you work long hours as it is, and this is surely added to those hours. Thank you for giving me just a moment, Mr. Chairman, on behalf of my institution, to thank you for this proclamation. We're proud of you for your public service, but it's a special point of pride for me and for our institution that 3 of the commissioners, Mr. Chairman, and Commissioner Harden and Commissioner Rodriguez McDowell, have degrees from UNC Charlotte. So we appreciate the endorsement of the entire board tonight and wanted to mention that special fact about the commission. That was April 30th. It's hard to believe that it just in 8 days will come around again. It seems like yesterday to me. I've been in weekly contact with the Parlier and Howell families, and I can tell you that the pain they feel is as real today as it was the day it happened. But if there was any kind of silver lining in the dark cloud of April 30th, it was the tremendous support that we received from the city of Charlotte, the region, the state, and the entire country, as a matter of fact. Their support and compassion meant the world to us, and to get through it was very, very difficult. Certainly the toughest thing I've faced in my professional life. We had big plans for a first anniversary remembrance. We had engaged with the Charlotte Symphony and the Blumenthal Center, and they were wonderful partners to put together an evening of remembrance on April 30th that would have been, I think, quite fitting. But of course, the virus has thrown that entire idea off track. So we have created and will live stream on April 30th at 5:10 p.m. in the afternoon, a remembrance program, and it'll also be available on our Facebook and Twitter channels. It'll involve some remarks from several university representatives and students, some special artistic performances, and we want to do in some small way, not forget that day in our history. We want to also thank the county for all that you meant to us on that day. The county sheriffs, of course, medic, the emergency management department, and then more recently, some very collaborative conversations I've had with your county manager about whether the university could support a field hospital. And those were all done in the spirit of partnership, and I know that'll continue. I'm going to retire June 30th. I'm in fact leaving Charlotte to give our new chancellor a little bit of space to establish themselves here in Charlotte, but I want to thank the commission and all of you individually for the support you've provided me during my 15 years as Chancellor. So go Niners, Mr. Chairman, that concludes my remarks.
Thank you, Mr. Chancellor. And we were aware of the fact that you are going to be leaving. So we hope to have you before us at least one more time before you depart. But thank you for your comments.
Thank you very much.
Okay, Madam Clerk, are there any persons present for the public appearance?
Yes, Chair Dunlap, there are 2 speakers.
Okay. At this time, I must read the following comments. Public appearance is the period in the board's regular meeting that the members of the public are provided the opportunity to speak on matters not appearing on the agenda. Members of the public who appear during the public appearance portion of a regular meeting may discuss any matter within the jurisdiction of the Board of County Commissioners, except for the following type matters. A matter which concerns the candidacy of a person for public office, including the candidacy of a person appearing before the board, a request that the board consider funding a certain program or activity, either from the current budget or by inclusion in a future budget. Such requests would be made at the board's annual public hearing. I remind our speakers that the time limit for speaking is 3 minutes, no more than 3 minutes. You will hear a buzzer if you go over 3 minutes, and we would ask that you stop upon hearing the buzzer. You will be recognized in order, and you will have 3 minutes to speak. The clerk will now call on the speakers.
The first speaker is Fonda Hill. Go ahead, Ms. Hill.
Thank you. I wanted to implore you to lift the stay-at-home order. My belief is all jobs are essential. Lives and livelihoods are equally important, and we can't have one without the other. I understand we're fighting an invisible enemy, and it's not my desire that anyone should lose their life should they become infected with COVID. However, the stay-at-home order is limiting individuals' ability to provide for their family. Let me just point out a few things that I've seen. The lockdown was never about reducing the number of people who would get infected, but it was always about delaying the spread. So when people did get infected, the healthcare system could handle the volume. We need to reopen to gain herd immunity because it will spread again. At no point since the lockdown has been issued has our healthcare system in this county or state been overrun. In fact, we are seeing many healthcare professionals in areas laying off or furloughing employees. And also, there's been recent reports that several businesses will either file bankruptcy or will be unable to reopen, affecting the very people each of you are representing. My recommendation is that we begin a slow reopening of businesses in our community. No one is looking to be part of a large crowd or high-density situations, but we need to loosen the restrictions and get people back to work. I've spoken to some small business owners. They are already preparing for common sense measures to protect their customers and their employees when they reopen. The models have been wrong from the very beginning. What is being used as the baseline? How do you know that the peak hasn't already been reached? What data and models are being used? There needs to be full transparency, and the call for more COVID testing is just a stall tactic. To consider extending the lockdown, there needs to be clear data and statistics to support the order, as well as a well-defined plan to reopen the community with a specific date. It's imperative that we get the community be reopened. Without that, we're going to see an uptick in joblessness, suicide, domestic violence, child abuse, mental health, crime, homelessness, food shortage, alcoholism, and substance abuse. Will the healthcare system be able to handle that load? Are you willing to exchange the short-term gains of the lockdown for long-term suffering? I'm not, and I believe there are several others who would agree. If given the choice between safely reopening or staying closed, I will take a calculated risk with reopening, knowing that the so-called cure is far worse than the virus itself. For those who are concerned about lifting the stay-at-home order, there's no requirement for them to have to go out. We definitely want to protect those who are the most vulnerable. That's always been the case, but we need to strike a balance. That concludes my comments. Thank you.
Thank you.
Okay, the next speaker is Adam Huminski. Go ahead, Mr. Huminski.
Thank you to the commission and to the leadership of the county for letting me have a moment. And thank you to Ms. Hill. That's a tough act to follow. My points to make today are similar to Ms. Hill. Decisions are being made about the shutdowns from a public health standpoint, which makes sense. But these shutdowns are causing second and third order effects that will be far outside the sphere of public health. An example is plummeting demand from businesses such as restaurants and retail that will cause supply chain disruptions that will end up being much worse from an economic standpoint and are far outside the public health and medical science expertise. These effects must be considered because at some point we will cross a line in the economy that has never been crossed. For example, I have no idea myself how this will affect tax revenues, nor what programs might have to be cut as a result, but I assume across the localities and across the state that it will be significant. And to Commissioner Gerald's point earlier in the call, the impact of those cuts and those economic disruptions will certainly be disproportionate. Second, I would like to speak to the reasonableness of making decisions based on computer modeling. I grew up in Northeast Ohio, where a snow day meant that you woke up and there was so much snow that you could not reasonably leave the house. But in recent years, we have begun canceling schools because of the threat of snow. And how many times, maybe at least once a year, does school get canceled and it turns out to only be a small dusting of snow or even a beautiful spring-like day? And are we to believe that meteorological models are any less complex than epidemiological models? To miss a call on a snow day is annoying. To miss a call on a pandemic and the severity of a virus is and will be devastating. And to date, the models, as Ms. Hill mentioned, predictive models have done poorly. We need to pivot to actual data and not rely solely on forecasts. Third, people are concerned about the effect that the virus has had elsewhere. But is it really appropriate to compare North Carolina or Mecklenburg County to New York City in any meaningful way? A city with 12 million people in 1 square mile, a decaying and crowded public transportation, lots of people using elevators in crowded apartment buildings. Are we similar in any way? And why is Central Park open, but North Carolina National Forests and county parks are closed? To the residents of North Carolina, this makes no sense and it seems petty and punitive. We have actual data now from multiple sources that shows that this virus is not as deadly as once thought. The right decision 4 weeks ago is not necessarily the right decision now. We should be encouraging the young and healthy to get back to normal so community immunity can build up, and in the meantime, work to protect the vulnerable. Common sense measures can be enacted, such as more stringent controls on elder care facilities, and guidelines will allow people to continue to work from home without reprisal. Wanting businesses to open and caring for people's lives are not mutually exclusive. Thank you.
Madam Clerk, is that all of our speakers?
That concludes our speakers.
Thank you. At this time, I will move to the manager's report. Let me share with my colleagues that there are 3 updates under the manager's report. They will all be combined. That is the COVID-19 response update, the COVID-19 federal relief update, and the COVID-19 and the homelessness update. I would ask that you write down your questions so that at the end of these 3 presentations, you will have an opportunity to ask questions. You will be provided an opportunity to ask questions for 7 minutes. Then we will allow someone else to ask questions. And then you will get a second opportunity with a 3-minute time limit. So at this time, we'll move to the manager's report.
Thank you, Mr. Chairman. Before I start on the COVID-19 response update, I do have one other announcement I'd like to make, and that is that Michael Bryant will assume the position of Assistant County Manager to fill Mark Foster's position, who is retiring at the end of June. Mike has served as the Director of the Office of Management and Budget since 2014. He has been with the county since 2003 and has over 20 years of experience in city, county, and state government. Michael holds a Bachelor of Science degree and a Master's of Public Administration degree from NC Central University. He is an inductee of the NC Central University 40 Under 40 Alumni Award, an honor given to young alumni that have exhibited leadership, dedication, and success within their profession and personal communities. Also in May 2019, Michael was appointed to serve on NC Central University's Board of Visitors. Michael is a recipient of the John Voight Lifetime Achievement Award, a recognition of individuals who have advanced the field of budgeting and or evaluation in North Carolina local government. Michael is a member of the Government Finance Officers Association of the United States and Canada Executive Board, and he has been selected to serve as president-elect of the GFOA beginning in May of 2020. He is a graduate of the National Forum of Black Public Administrators Executive Leadership Institution, a former president of the Southern Piedmont chapter of NFBPA, an American Leadership Forum Senior Fellow, a North Carolina Governor's Public Management Fellow, a graduate of the Public Executive Leadership Academy, and a graduate of the Leadership, Educating, and Developing program at the University of Virginia. So I hope that you will join me in congratulating Michael on this very, very well-deserved promotion, and we are very, very excited to have him join my executive team. So I just wanted to announce that publicly today.
Thank you.
You're welcome. So just have a couple of updates before I turn it over to Gibby. I had sent an email to the board, I believe it was yesterday, just letting you know that I'm establishing a business leaders roundtable to assist Gibby and I and the public health team and emergency management on a soft opening of our economy. We believe we're at a point now, to go back to what the speakers were saying, is that we need to start looking forward and really trying to understand what a soft opening of our economy looks like, what a phased opening of our economy looks like. And so I'm very fortunate to have a number of people who have agreed to participate. We have representatives from financial services, retail services. We have the LGBTQ chamber, the Black chamber, the Latin American chamber of commerce, higher ed, sports, small business, retail, professional services. Commissioner Mark Jarrell will also be participating, as well as a representative from the governor's office. So it's a very, very diverse group of people representing many constituencies, many different lines of business, to really start to have that conversation around how we reopen our economy and keep people safe. And so we're very excited about being able to move forward with that. We have the first meeting will be Monday morning at 8:30. And we'll start to look at some parameters about what we would need to see in order to start a soft opening and start understanding from a business perspective what that means for Mecklenburg County. And so we feel good about where we are, and the interest from the business community has been overwhelming. And so I think that's going to be a tremendous partnership. So we will continue to keep you posted. And again, Mark Jarrell is your representative on the roundtable, and I'm sure he'd be interested in reporting out on a regular basis on our activities. The other thing, as you know, our order locally here expires on April 29th, the same day as the governor's order expires. We do not know at this point what Governor Cooper will do in terms of extending his order, but we do believe that there should be another 2-week extension of the stay-at-home order. We think that in order to be able for us to plan properly and to make sure that we have everything in place that we need to move forward with a soft opening, that a 2-week extension of the order would make sense. We don't believe that locally we'll be able to get an extension of our order here locally. And so we are going to be turning to the governor to move forward with that. And one of the recommendations I wanted to make to the board is if we would craft a letter on behalf of the board signed by the board chair to the governor requesting that he keep his order in place for another 2 weeks based on what we're seeing here on the ground in Mecklenburg County to allow us more time to plan and to be ready for our soft opening. And so that is a recommendation I'm making to the board. I know that you want to take questions at the end, so I will defer any questions at this time. But I think that's something that would be good based on the fact of what we're hearing from other counties around us in terms of what they want to do. Their voices are being heard. And I think your voice should be heard as well in terms of what you think is best in the best interest of our county here. So with that, I'm going to turn it over to Gibby and Raynard Washington, who is our Deputy Health Director, to give you an update on the data that we're seeing here in the county. Thank you, Mr. Chairman.
Madam Manager, before we move on, let me first recognize Commissioner Susan Harding, who has joined us.
Good evening. Thank you for allowing me to join.
All right, and then second, we'll hold that motion until the end of your presentations. And if somebody would make that motion, we'll entertain it at that time.
Thank you, Mr. Chairman.
Okay.
Gibby?
Yes. Good evening, Mr. Chairman, commissioners, and the manager. Thank you for allowing us the opportunity to talk to you briefly tonight to update you on the situation that we have in Mecklenburg County. So as of the end of today we have 1,331 laboratory confirmed cases that have occurred in Mecklenburg County. Unfortunately, that's an increase of 76 cases today, which is one of our highest days that we've seen so far. We've had 3 additional deaths today reported to get us up to 35 deaths in the county. 8 of those 35 have been in nursing home residents. In addition to that, what we know now is that we've conducted over 20,000 tests in Mecklenburg County through both Novant and Atrium. That started on March 11th through today. We do not have a complete listing of the number of tests completed because some of the smaller facilities, urgent cares, and doctor's offices that have conducted some tests do not report the number of tests to us. We just get the confirmed positives from those tests. In the testing sites that were open last week through Novant and Atrium, there were 5 days of testing and a total of 289 tests completed at the new sites. And we're working with them on data so that we know of those new tests that are completed in those sites, how many will be positive. We'll be able to report that moving forward. This week, they have a total of 8 days where there will be testing. 3 of those are mobile at 3 different sites that Atrium is conducting, as well as the 3 sites that Novant has open at this point in time. In terms of our data overall, we're continuing to see most of our cases in 20 to 59-year-olds. We have had 3 infants now who have been infected. Those are children under the ages of 1. All of them have recovered well, which is good news. We've seen a slight increase in the number of Hispanic positive tests and a slight decrease in the number of African American positive tests. We've also we're seeing sort of a leveling of our hospitalizations around COVID. We're watching that very closely. And currently our mortality rate is around 2.4%. Wanted to talk to you briefly. There's been a lot of conversation and discussion around long-term care facilities. So I wanted to give you just an overview of the work that we do with our long-term care facilities. As you know, we have 8 long-term care facilities that are in outbreak status at this point in time in Mecklenburg County. An outbreak status is defined by the state and by CDC as 2 or more cases, either in staff or in residents of that facility. So when we have a reported case, the first case in a long-term care facility, there is a case interview that is done, both either with the resident or the staff who are infected at that point in time. We speak both with the resident as well as with the administration of that facility to make sure that we fully understand the situation there and understand who the potential individuals are that have been exposed, whether that's staff or residents. We have a process that we go through with them. If it is staff, we have conversations with them about what the return to work guidelines are, as well as removing them from home isolation guidelines. In addition to that, we provide review and copies of current guidance with the Long-Term Care Facility Administration and the Director of Nursing. That includes documents from the state around investigation of COVID-19 cases in long-term settings. As part of the North Carolina Executive Order 131, we look at long-term care risk mitigation measures and review those with them. We provide them with a monitoring log that they work with us on a daily basis, and we also give them information on risk assessment for their staff. We assess the facility's current PPE supply, and we have been working with the Emergency Operations Center to make sure that all of them have at least a 1-week supply at all times. There is a website at the state where they can order supplies directly. That is starting to come in. In the meantime, we're making sure that those supplies are coming from the EOC if they do not have them. We're also working with them on the CDC strategies for optimizing the use of their PPE. We discussed the facility's planned communication strategy with other residents and or with their families. That is work that we do on an ongoing basis. We talk to them about what that communication looks like, and we have provided sample language for them on how to communicate with families as well as with residents. And if you've seen today, there was news from the CDC that they are now requiring long-term care facilities to notify family members as soon as a resident tests positive for COVID-19. Evidently, there have been some cases across the country where that's not been happening, and so that is a requirement at this point in time. For those who don't know, long-term care facilities in North Carolina are licensed and managed by the state of North Carolina. They are not managed or licensed at the local level. So we have been engaging with the state on a regular basis in their communications with these long-term care facilities. In addition, once we have an outbreak in a facility, we engage our environmental health staff who manage with that facility to evaluate their current situation in terms of cleanliness and the particular things that they need to do to protect clients. That is done immediately. That's standard practice for us anytime there is an outbreak in a facility. We have an entire process around documentation and notification. As soon as there's an outbreak, we are notifying the state of that and continuing to work through that process to make sure we're documenting everything we need to and that the proper authorities as well as the families are notified in the way they need to be. We continue to assess the needs and the issues in those long-term care facilities. We're working with them to make sure that they are able to isolate the individuals who are positive. And any testing that they decide to do at this point, there's not a requirement that they test everybody, but some of the facilities are doing that at this point. They're recognizing individuals who are asymptomatic but test positive. They're isolating them as well. So we continue to work with them on that. And then there's ongoing follow-up with these facilities almost on a daily basis. They have access to us at any point in time that they have questions, but we're also working with them daily to make sure that they're following through in the ways that they need to. So I wanted to make sure that you had that information about how we work with these facilities. This is pretty intensive work with them to make sure that they are getting what they need and that their residents are getting what they need. As we get towards the end of this, I'll be happy to answer any questions you have about any of that. Also wanted to remind you that the toolkit was rolled for messaging, especially for African American communities, was rolled out on Friday. And there was a webinar that was done on Monday that allowed people to hear about the toolkit, how it can be used, and to be able to ask questions that they may have about the toolkit. In the toolkit are flyers that can be printed or shared digitally. There are infographics, digital images, and other messages for social media, email, blogs, and websites. There's accurate talking points on COVID-19 topics. And we are in the process of making sure all of that is translated into Spanish. In addition to that, we have rolled out some radio and print this week. And there are a number of different radios that we're working with that specifically speak to the African-American community, both the younger community as well as the elderly in that community. And we're working with many of our community partners to get all of these messages out. I would encourage all of you that use social media to look at the information that's available in the toolkit and use that widely. We greatly appreciate it. That is about all I have for right now. I'm going to ask Dr. Raynard Washington, he is our Deputy Health Director, talk a little bit about our projections and some of the data that we're seeing at this point in time. Raynard?
Thank you, Gibby, and good evening to everyone. Thank you, Chairman Dunlap, and to the commissioners for the chance to speak a little bit about what's going on the data side. Let me first say thank you to our healthcare systems, to Novant and Atrium for all their work and working alongside us in this response and providing data for us on a daily basis. And we are exchanging data on a routine basis to help us inform our response and actions that we're taking. So we've been working very closely with them, and I just want to say thank you to their data science teams for making sure we have the information that we need to make our decisions. and understand sort of what's happening in the county. Also, thank you to our epidemiologists within the health department and to our communicable disease teams who are working really long days to make sure we have all the data available in a timely manner and can really monitor what's happening and how this situation is evolving in our community. There have been a lot of questions and discussions about projections. As an epidemiologist, I'll be the first person to tell you that these models are certainly imperfect, and has already been said tonight. They're very similar to a weatherman's forecast. But I do think that they're very useful tools to help us inform our response and help us better understand what might be to come down the road. Earlier this week, we released some new projections, as well as we shared another document with additional details about what how we're building these models and what we think they tell us to ensure that there's transparency. I'll say just in short, what I think is really good news is that we're making progress towards slowing the spread of this infection in our community, effectively flattening the curve. That doesn't mean that the infection isn't still spreading in our community. We know that's not the case. It just means that fewer people are being infected at one time, as already has been noted. And that really for us and our region lowers the likelihood that we'll overwhelm our healthcare system to a point where we won't be able to provide care to folks. It doesn't mean we're out of the woods by flattening the curve. It just means that we are looking at a much better situation than we would have been had we taken no action at all. We must continue to closely monitor sort of the situation with the data that we have available and the current status of our hospitals, both in terms of their supplies, their staffing, the personal protective equipment, and ventilators. This is really important, not just for the care of COVID-19 patients, but also for the routine care they provide to our community every day. Things like delivering babies and caring for folks who have acute healthcare issues. I'll make one note about the dates, the peak dates, or the dates that we expect to reach the highest needs in terms of our healthcare system. They will continue to extend out further, and they are, and you probably have noticed that. If you've seen multiple versions of the projections, you'll see they're also lower than what they would have been previously. And I reiterate that this date's really important, but it does not by itself determine when we make decisions about things like the stay-at-home order. So while the date that we think we might reach our highest level of healthcare need might be sometime in middle to late June, or maybe even extending out further in the summer, it in and of itself does not determine or dictate the date at which we take certain steps towards returning to what I believe to be a new normal. Lastly, I'm sure I'll just also note that I'm sure you've seen projections from the federal level and the state level, and some of these models really paint a more optimistic picture. But I just encourage and employ everyone to remain vigilant as we monitor our local experience. We do have a higher population density here than many other areas in the state, and that increases how fast the virus is likely to spread in our community. So our current rate of infection is twice that of the state, and while we only make up about 1/10 of the state's population, our residents are about 18% of the confirmed cases in the state and almost 16% of the deaths in the state. So we do have a different experience, and it's really important for us to continue to monitor very closely what's happening here locally. So thank you all again, and that's it to my comments.
Madam Manager?
Yes, Mr. Chairman, with that, we can move on to the next item under my manager's report, which is a legislative update on the COVID-19 federal relief. And I will turn it over to Starla Tanner.
Thank you, Dina. Good evening, Chairman Dunlap, Commissioners, Manager Dioro, and those attending remotely. Thank you for the opportunity to provide an update on federal legislative actions related to the COVID-19 crisis. I just want to do a check-in to make sure the slide are showing. All right, next slide. This presentation will highlight the federal agenda you approved earlier this year, COVID-19 related legislation that has been passed, anticipated legislation, and our engagement that we've had with our delegation. Next slide. Our federal legislative engagement efforts center around the 4 priority areas approved by the board. Those areas are health and human services, education and community development, infrastructure and finance, as well as public safety and criminal justice. These areas, combined with the county's 4 guiding principles, provide the baseline for the county's advocacy with our congressional delegation and national organizations such as NACO. Our legislative principles are to support legislation that grants counties greater flexibility, support legislation that provides funding to counties, oppose legislation that removes funding from counties, and to oppose legislation that would create an unfunded mandate or directly or indirectly shift costs to counties. Next slide. It has been 46 days since the first congressional response to the COVID-19 crisis was passed. Since then, 3 bills have been enacted, with a 4th bill being voted on this week. The pace of things in Washington, D.C. at times has been unpredictable and often includes multiple changes in strategy and messaging from stakeholders. However, I am happy to say that what has been consistent are the advocacy efforts of NACO, peer counties, our lobbying firm, Smith, Dawson, Andrews, and your county staff. As I provide highlights of the bills, you will hear about millions and billions of funding. It is important to note that the majority of these funds will flow through the state, and the funding formulas and disbursements are still being determined. As I've been on the call tonight, our lobbyist has just sent me a text with new guidance, so it continues to evolve. Next slide. The first bill passed was the Coronavirus Preparedness and Response Supplemental Appropriations Act of 2020. This was the first emergency response bill. It provided $8.3 billion in supplemental funding to support preparedness and research for a vaccine. Funding through this legislation was directed to the Department of Health and Human Services, the State Department, and the Small Business Administration to respond to the outbreak. This included addressing such issues as developing, manufacturing, and procuring vaccines, grants for states, local and public health agencies and organizations, loans for small businesses, humanitarian assistance, and support for health systems in affected countries. The information on the slide before you indicates the large buckets of the funding targets for the bill. Under this bill, each state is entitled to receive up to $4 million in public health preparedness grants. We are working with the state and federal officials on the sub-allocations for this funding. Next slide. Bill 2 was the Families First Coronavirus Act. This legislation consisted of 5 key provisions. First, it ensured free testing. Secondly, the bill provided funding for food assistance, including more than $1 billion in additional funding for food nutritional assistance programs, including those which target children impacted by school closures and needs of local food banks. It also increases by 6.2% the federal medical assistance percentage that the federal government provides to state Medicaid programs. This temporary increase is intended to prevent states from cutting Medicaid benefits and preserving existing cost-sharing agreements. This second bill also gives states resources and flexibility to provide unemployment benefits to laid off and furloughed workers, as well as those who exhaust their allotted paid leave. And the bill contains 2 major overhauls to paid leave programs. It provides assistance to employees and families by expanding the Federal Family Medical Leave Act, or FMLA, and it created emergency paid sick leave. Of special note is that while this legislation provides employers with tax credits to offset the costs associated with the expanded programs, public sector employers are explicitly prohibited from receiving these same tax credits. This is an issue that we're advocating for. We're hoping to address this as a correction in future legislation. Next slide. The Coronavirus Aid, Relief, and Economic Security Act, more widely known as the CARES Act, is the third legislative item passed by Congress. This is a $2 trillion package, the largest economic rescue package in U.S. history, as I'm sure you know. As you can see from the slide, the CARES Act is a comprehensive bill that was designed to provide direct relief for American workers, families, and businesses. Major highlights of the bill include $150 billion for the Coronavirus Relief Fund to support states and local governments, areas with over 500,000 residents, are eligible to receive direct funding from the Department of Treasury under this provision. The initial guidance of this funding excluded eligible counties such as Mecklenburg, whose jurisdiction included a city that alone was comprised of at least 500,000 residents. However, with a significant amount of advocacy, including letters and emails from myself and from Dina and NACO and other peer urban counties, we worked to have the guidance adjusted. Earlier today, we were informed that our funding would be provided soon. The CARES Act also provided direct stimulus funds for workers. Additional funding that will be provided through the state or federal agencies include, as you see on your slide, $500 billion for the Department of Treasury Economic Stabilization Fund that authorizes the Treasury to purchase obligations of states and local governments to cover losses incurred as a result of the crisis. This fund also provides loans and loan guarantees to eligible businesses. The bill also provides $100 billion to address medical surge capacity for hospitals, $4.3 billion to support federal, state, and local public agencies, $45 billion for the FEMA Disaster Relief Fund, $25 billion for transit systems for operational support, $6.5 billion for CDBG and Economic Development Administration, $75 billion for affordable housing and homelessness assistance, and $850 million to support addressing the needs of local police departments and jails, including purchase of personal protection equipment. Next slide. Those are the three bills that have passed so far. The next steps include continuing to work with state and federal agencies on the process for funding, which may include grant applications, some that we've already submitted, or allocation by census number or another formula such as the method using CDBG funds. We are cautiously watching those processes being prescribed due to the fact that several of the formulas do not take into account the different roles of cities and counties. As I shared in the previous slide, we do expect to receive a direct allocation from the relief fund. That amount is estimated to be over $41 million. The city of Charlotte will also receive money from this fund as its population is over 500,000. The guidance for this funding continues to evolve. For now, the funds cannot be used to cover lost revenue and can only cover items not previously in the budget and must be used by the end of 2020. There are advocacy efforts underway to have the guidelines expanded. We also anticipate receiving $58,000 from the Justice Assistance Grant to support personal protection equipment for county law enforcement. Following funding opportunities has been and continues to be a team effort. Our finance department is working daily along with me to track opportunities for funding and reimbursement. We expect to know more about funding in the next several weeks. Combined with the beginning of the state legislative session and possible state funding, there is still a significant amount of details that are forthcoming. Next slide. Yesterday, the Senate passed more than a bill that includes more than $400 billion in interim emergency relief in the Paycheck Protection Program and Healthcare Enhancement Act. It's referred to some as Bill 3.5 because it's considered an interim bill with another bill expected to follow quickly. This bill still has to be voted on by the House, so it's certainly not included in our past legislation. The bill includes, or should include, if it's passed and not changed, $310 billion to replenish the Small Business Administration Paycheck Protection Program, funding for separate disaster loans to small businesses, $10 billion for the Emergency Economic Injury Grant Program, and $11 billion in direct funding for states, localities and territories to scale up the administration's COVID-19 testing, laboratory capacity, contact tracing, and support employer testing. The House is expected to vote on the measure as soon as Thursday. And if you receive the updates from NACO, I believe they just in the last maybe hour and a half sent out an update about this particular bill. What this legislation does not include, despite tremendous lobbying, is additional support directly for states and counties where the frontline work is being conducted on a daily basis. So that's the bad news about the latest bill. However, the good news, if you consider it that, is what you can see from the slide with the tweet made by President Trump yesterday after the Senate voted on the bill. More help is hopefully on the way. There is recognition that this bill does not include additional funding for states and for counties. The next bill should include that, and we'll continue to track that work. Next slide. In conclusion, I want to share that our engagement with our delegation members is continuous. We have been in touch with staff members from each office, sharing our perspective and expressing the needs in the district. Next week, the board will have an opportunity to talk with Congresswoman Alma Adams and receive an update and exchange information and questions with her. The North Carolina County Commissioners Association has conducted calls with delegation members inviting real-time questions and answers. And lastly, we've shared the advocacy alerts from NACO with our delegation, especially as it relates to direct funding to counties and the ability to use funding for revenue loss. And last slide. Mr. Chairman, Commissioners, thank you for the opportunity to highlight the federal legislation related to the COVID-19 crisis. Please know that it is continually evolving. We are working to track it, and certainly including our stakeholders, working with our delegation, both at the federal and state level. This concludes my presentation. Thank you.
Thank you, Starla. And I just want to thank you for all of your hard work. Starla has been working nonstop on these legislative issues and tracking this every second of the way. So I just want to know how much we appreciate everything that you've been doing. So thank you so much. And then next, Mr. Chairman, we will hear from Anthony Trotman, who is going to give you an update on how we are supporting our homeless residents during COVID-19. We've gotten a lot of questions from board members about this, and there's been a lot going on. So I've asked Anthony to provide this update to you. And with that, I will turn it over to Anthony.
Good evening, Chairman Dunlap, Board of Commissioners, and County Manager DiOrio. Tonight, I will provide a brief update on our homeless response to COVID-19. Next slide. For this presentation, I will review the magnitude of homelessness in our community and the services and funding we provided towards this issue before COVID-19, our initial and ongoing efforts during the outbreak of COVID-19 to help the homeless of our community, and our proposed plan to assist people who are unsheltered in our community. Next slide. Next slide. As everyone is well aware, homelessness was a significant social problem in our community prior to COVID-19. We have a couple of ways we attempt to understand the severity of this complex issue. We lead our community's annual point-in-time count survey, when a team of homeless service providers and volunteers come together one night in January to survey the number of people experiencing sheltered or unsheltered homelessness. The results from the 2020 survey will be released this fall, but the data from the 2019 documented 1,742 people as homeless on that night. We also attempt to understand the issue through the one number, which is highlighted on this slide. This is our best estimate of the total number of homeless individuals in our community. As of March 31st, this number was 3,683. Not everyone included in this number is on the streets or unsheltered. Many are in shelters and some are in transitional housing. More data and information about homelessness in our community can be found by going to our Housing and Homeless dashboard at MECKNC.GOV. That's MECKNC.GOV. Next slide. We offer direct services for the homeless through our community support services and criminal justice service departments. The people we serve are of many different backgrounds and at various points along the housing and homeless continuum. This includes people at risk of becoming homeless, children and families, the chronically homeless, individuals with mental health and substance use conditions, and people re-entering the community from the criminal justice system. On this slide, you can see many of the programs and services operated by the county to help the homeless of our community. This includes coordinated entry, shelter plus care, criminal justice housing assistance for reentry program, social workers that staff permanent supportive housing programs with the urban ministry, and we manage our community's continuum of care governance committee as defined by HUD. Next slide. We also fund services and operations at our partner agencies, including homeless diversion, emergency shelter, legal advocacy, housing placement, and case management services. The partner agencies we fund are highlighted on this slide. We provide over $5.6 million to support these agencies. And through our rental subsidy fund, we provided an additional $5.7 million to the Foundation for the Carolinas Away Home Endowment to create MECKHOME. The program provides rapid rehousing, rental subsidy, and supportive services to families, youth, and individuals who are homeless and earn less than 30% AMI. So far, 19 households, a total of 57 people, have moved into housing through the MECKHOME program. We also provided $1.7 million from the rental subsidy fund to the Men's Shelter and Urban Ministry Center for Link Housing, a program designed to house long-term shelter guests. 7 people have moved into housing with the Link program so far. Between our county programs and our operational support for nonprofit agencies, we invested over $20 million in homeless-related services during FY20 prior to COVID-19. Next slide. Next slide. As the COVID-19 crisis unfolded in our community, Mecklenburg County began coordinating a weekly call with community providers who serve the homeless to ensure a comprehensive response. A discussion centered on how we could all work together to maximize our current resources to help the homeless during COVID-19. We requested that the agencies prepare a continuity of operations plan and identify additional activities to slow the spread of COVID, such as hand washing, education, and ordering additional cleaning supplies. Next slide. Working with the United Way, the Foundation of the Carolinas, and the City of Charlotte, the Board of Commissioners helped establish the COVID-19 Response Fund in the wake of the crisis. Over $16 million has been raised for the fund so far, with donations coming from many businesses, churches, and individual donors. The county contributed $1.3 million to the fund, much of which goes to homeless-related services. The funding provides additional support to the agencies listed on this slide. Next slide. From the beginning of the COVID outbreak, the Men's Shelter, Salvation Army, and Safe Alliance were involved in helping us coordinate our shelter response. Because of the need for social distancing, the Men's Shelter and Salvation Army were unable to offer the 100 overflow beds that they normally provide. To address this reduction in community shelter capacity, we've been working closely with the Men's Shelter, Salvation Army, and Safe Alliance. So far, the county has rented over 300 hotel rooms for shelter guests to be able to practice social distancing and isolation and quarantine. This helped make the shelters and their guests safer by reducing overcrowding. The county provides food and laundry services at the hotels. We also provide security. Our budget amount for these hotels is approximately $1.4 million. This is in addition to the $20 million that we already are providing. When a shelter guest tested positive for COVID-19, they were quickly placed in the quarantine and isolation hotel, as were other shelter guests who could have been exposed. The EOC coordinated transportation to the hotels for all of the affected shelter guests. Along with these efforts, on Monday, April 13th, City Council members voted to approve funding of $1.3 million for 120 rooms for homeless individuals and families at the Men's Shelter and Salvation Army for up to 8 months. This will create additional capacity at both of these shelters to serve the community's unsheltered population. Next slide. On March 16th, North Carolina Chief Justice Sherry Beasley issued a court order delaying civil court proceedings, including evictions and another order allowing sheriffs to delay performing evictions on previously issued eviction orders. He recently extended these orders to June 1st. The North Carolina Attorney General's office issued a letter to almost 100 hotels in Charlotte to halt evictions in accordance with Judge Beasley's order. The president of the Greater Charlotte Hospitality and Tourism Alliance issued a statement asking his group members to halt their hotel evictions as well. The county partnerships with legal aid continues to be a resource. Legal aid has assisted with eviction prevention for clients at 100 different hotels during the last 2 weeks alone. The county is leading an effort with many nonprofit agencies to help people at risk of hotel evictions by connecting them with funding to pay their hotel bills and other available community resources. And on Monday night, I was contacted by City Council about the Days Inn Hotel on Woodlawn that was closing down Tuesday. There were 14 families remaining at that hotel, and the power and water was shut off on Monday night. We quickly contacted legal aid and activated our coordinated entry social work team to assess the hotel guests. Legal aid contacted the corporate office because the hotel's management office had already closed. Legal aid informed the hotel that they would file an injunction to have the power and water turned back on, but the corporate office did so without an injunction. Our social work team is working with each hotel guest to relocate them to another hotel or housing option. Funding is available through Community Link and Crisis Assistance Ministry to assist guests in relocating. And crisis assistance funding comes from the Department of Social Services. Aaron Pelletier, our CSS business manager, is leading this effort and managing the team of social workers. This may not be an isolated issue, so we are developing a longer-term strategy to work with current hotel guests in other hotels. Next slide. We're partnering with our hospital systems to provide further assistance and protective measures for the homeless in our community. The EOC has representatives from Atrium and Novant, as Gibby described. They're working to refine the testing process for homeless individuals who are symptomatic. And we are communicating with our homeless providers, as I indicated, on a weekly call to discuss the testing process for homeless individuals. We've been working with Novant over the last several weeks about their efforts to support the community. They are obtaining a large inventory of face masks and have committed to working with our shelter partners to share them with our sheltered and unsheltered residents. Next slide. We've been asked to provide transportation for COVID-19 testing for homeless and vulnerable residents in our community who are asymptomatic. We are working with our current transportation vendors to provide this service. Next slide. There's also work being done to assist people who are unsheltered and in homeless encampments throughout the county. The CDC guidelines for the unsheltered homeless include not clearing encampments during COVID-19 because this increases the potential for spread of the disease. Encouraging people staying in encampments to set up their tents or sleeping quarters with at least 12 feet by 12 feet of distance. If toilets or hand washing facilities are unavailable nearby, to provide access to porta-johns with hand washing facilities for encampments for more than 10 people. And to plan for where individuals and families with suspected or confirmed COVID-19 can stay safely, including places where people can be isolated. And where possible, we've attempted to work with our partners to respond to all of these guidelines. Next slide. We've had 2 conference calls with the Greater Charlotte Rise Advocacy Group to discuss their concerns regarding the unsheltered population. We shared our current efforts to help the homeless during COVID-19, and we felt their initial proposal was larger than the COVID-19 effort and was focused instead on responding to the broader unsheltered issue in our community. MECKNC then issued a letter to the EOC, City Council, and Board of Commissioners on April 9th, requesting further action for the unsheltered population during COVID-19 as well. We scheduled a conference call with MECKNC, and the Greater Charlotte Rise organization joined the call. Next slide. We discussed each of the concerns outlined in their letter and shared the following information. Law enforcement will not seek to break up or disturb existing tent encampments unless the encampment is on a private property and a request is made from the property owner to law enforcement. The county has placed 6 porta-johns and hand washing stations in locations across the downtown area that are frequented by the homeless population. And our Parks and Recs Department deployed porta-johns at 17 park sites after the closure of park restrooms. The EOC has also worked with nonprofits and advocates to identify 12 additional locations where porta-johns and hand washing stations could be placed. We've asked that the Urban Ministry Center take the lead on operating all 18 locations that serve the unsheltered homeless, and they have agreed. Shower services have come up as a concern as well. Mobile shower van is no longer operating in our community. The showers are available at Urban Ministry Center's College Street location 7 days a week, which the unsheltered in our community are familiar with that location. Hotel evictions was another item included in the letter, which I shared our response earlier in this presentation. Next slide. We also discussed MECKNC's request for an additional 100 to 120 hotel rooms for people who are unsheltered and living with one of the CDC's high-risk factors for severe disease. This population often experiences mental health and substance use issues as well. The proposed project from the group will be ended shortly after the end of the stay-at-home order. We requested that MECKNC, Greater Charlotte Rise, and Urban Ministry Center submit a proposal outlining how they could successfully run such an operation. And after thorough review and discussion, we proposed an alternate solution. We were concerned that placing so many highly vulnerable people in one location with inadequate services and staffing will be more harmful than helpful. The unsheltered population are amongst the most vulnerable in our community and will potentially need comprehensive physical, mental health, and substance use services. Greater Charlotte Rise has operated an emergency overnight shelter for the last 3 winters at South Tryon Community Church, but their proposal is more similar to a supportive housing program and requires a thorough staffing plan similar to the structure we have at Moore Place. Instead of their proposed model, we offered an alternate solution to provide an additional hotel that is currently under contract by the county to the Men's Shelter and Salvation Army. This would allow many of their current shelter guests to move into these rooms, creating additional capacity to serve the unsheltered population in their shelters, where adequate staffing will be available around the clock. This is in addition to the 120 rooms that the city recently funded that I spoke of earlier in this presentation, and the 300 rooms that we have funded as well. We understand that many unsheltered individuals have declined going to the shelters in the past, but taking this approach, we create a shelter option for people who are unsheltered should they desire it. Next slide. And next slide. So in summary, we've continued to operate our homeless service programs and continue to provide significant funding to our partner agencies. As COVID-19 began to affect our community, we convened homeless service providers to ensure the most comprehensive response possible. We're currently operating over 300 hotel rooms for social distancing and isolation and quarantine to help the homeless. We have offered an alternate option to MECKNC, Greater Charlotte Rise, and Urban Ministries to provide an extra hotel for the current shelter guests at the men's shelter and the women's shelter. This would increase our capacity to serve unsheltered guests. And this concludes my presentation. Thank you.
Thank you, Mr. Chairman. That concludes all of our COVID-19 updates for today, and we're ready to take questions. Mr. Chairman, are you muted?
I was talking and I was muted, so nobody heard me. So let me go over that again. I remind everybody that you'll have up to 7 minutes to ask questions, and then a second opportunity with 3 minutes. You're not obligated to use that time. You can simply say pass. If you know who you want to answer the question, or either the manager can farm that question out. But we'll begin with our questioning period with Commissioner Copeland.
Oh, thank you, Mr. Chairman. And just so I understand, the 7 minutes is for all of these topics that we just heard, correct?
That's correct.
Okay, thank you for the clarification. I'd like to start off with Gibby, if I could. Gibby, thank you for your presentation. I wanted to know regarding the nursing homes, how many, you talked about extra staff, about how many extra staff are you using to work with our residents in the nursing homes? And I would also like to know if you have used or have consulted our nursing home advisory board to get some input from them or help, because they, as you know, visit the nursing homes. I thought they would be a good resource. And if you could answer those, and then I just have one more question for you.
Yes, ma'am. So we are using every avenue and every resource available to us to help work with these nursing homes. We've actually worked with MEDIC, who has some additional capacity right now. They've made a few visits to these facilities in addition to our environmental health staff to evaluate their processes and provide guidance based on what we have given them in the past. So that is one resource that we've used. We have attempted to be in touch with the ombudsman that works with these facilities so that we can have a better understanding of what they have to offer and what kind of input they can provide. So we're continuing to try to make that contact. So we will continue to move in that direction as well. What I will say is that we have, within our department, we have pulled at least 68 of our school nurses and retrained them around contact tracing investigation and work in this area. So we, what we do is we assign specific staff to work with the specific facilities. And each facility has multiple staff that have been assigned to work with them to make sure that we're readily available to them if the need arises. And as I mentioned earlier, we're also very engaged with the state and the regional offices that work with these facilities to make sure that we're all in lockstep and giving them the right guidance.
Oh, thank again, because I'm watching my time, I'm sorry to interrupt.
I'm sorry.
Could you clarify yes or no if you have had any dialogue with the Nursing Home Advisory Board?
We have not had direct contact with them. We were trying to work through the ombudsman, but we can be in touch with the board as well. We'll do that tomorrow. I
hope you consider it, because they are, you know, appointed here in Mecklenburg County, and I'm familiar with the ombudsman. Usually they're from Raleigh, but and I would also just like briefly, if you could tell me what the residents at the nursing home, what are they saying? Are they afraid? Tell me about the human part of this.
What we're experiencing with so we are limiting visits inside the nursing homes. We don't want to introduce new disease, but the interaction that we have had with residents has been very positive. We're getting good response from them in terms of the care they believe they're receiving, and we haven't had any complaints at this point.
Okay, thank you. Again, I'm sorry to cut you off. I'd love to ask.
That's fine.
Let me go to Starla. Starla, thank you very much for your presentation, and it was very thorough. I hope we can get a copy of that, and also all of these presentations. I wanted to know specifically, when we eventually get out of this time, will there be a post-mortem done so we can evaluate what worked well, what didn't work well, how we could have improved in dealing with our other bodies of government, and just general on that. Could you, and how we could improve? Could you comment briefly on that?
Yes, Commissioner Cotham, I think that's a great practice for us to do. It certainly will probably go alongside with our planning for 2021 for the long session and for the next congressional session, but absolutely, we can certainly review the process and the engagement and additional opportunities to increase our work effectiveness.
Okay, thank you. Again, I'm watching my time here, so I might email you some further questions, but let me move on to Mr. Chapman. Anthony, thank you very much for your comments. I saw that in the criminal justice services, we provide $160,000 for returning citizens. I am concerned now that our state and federal prisons are releasing inmates early, and since they have stopped the work release, they are going to come back to Mecklenburg County with no money, and also, they won't be able to get support as much if they could move around and talk to people. And I just ask you to consider increasing that because I'm hearing from families. I've had letters from inmates who are going to be released soon, several months before their end date, and they don't know what they're coming into as they come back to Charlotte. So I just ask you to think about that. You don't have to respond, but I just ask you to see if you can maybe improve that, or maybe have additional staff to help them, because I'm certainly going to be calling when they do come. Come back. Regarding the hotels that we have some folks in, when you give them access to a hotel, do you tell them how long they can stay?
Yes. For the social distancing hotels, those residents are from both shelters or 3 shelters, and the social workers from those shelters are also at those hotels managing those individuals. And so they know when the stay-at-home order is lifted.
Okay.
They have to go to the shelter.
All right. Again, I apologize for cutting you off. I do want to know, you said CNPD will not clear camps, because I have certainly heard from a lot of people, and I've gotten camps, I've gotten tents, new tents for people. My question is, when they do clear them, are they going to give them any warning? And I know my time is about up. Are they going to give them any warning, or are they just going to clear and then the person comes back from work and everything is gone again? Or can you ask for that, please?
I can ask for that.
Okay, thank you. I think my time is up, and thank you for being brief. I apologize that I had to interrupt you. Thank you, Mr. Chairman.
Commissioner Fuller.
Thank you, Mr. Chairman, and thank you to all for your very comprehensive reports. And as Commissioner Cotham mentioned, we only have a few minutes to ask questions. So if I could, at the beginning, have an opportunity to put my questions in written form and have you respond to them. I have many questions that I won't be able to get to either in this first 7 minutes or in the next 3 minutes. But these are questions that I do want answered. And so if I can just submit those to you in writing, and perhaps our county manager can coordinate getting responses to those questions, I would appreciate that. There is one matter that I wanted to spend some time on, and that has to do with the extension of our order. Did I hear correctly that the order is being extended 2 weeks, regardless of what the governor does? What was the announcement there?
Our order expires on April 29th and aligns with the governor's order. And so we are looking to the governor. We're going to ask the board to consider having a letter written on behalf of the board to the governor to extend his order. We are not completely clear that we could get consensus among the county, the city, and the 6 towns to be able to extend our order locally.
Okay, and so what is the state of that agreement? I understand it's not unanimous, but is it most people are wanting to extend it, or what's the state?
I think I think it's fairly mixed at this point. I think that there's some town mayors that are interested in not extending the order. And there are some that may be supportive. I think it's mixed, and I think we are better served if we could have one order that covers the entire county. And the only way we know we can achieve that is if the governor extends his order.
And if the governor does not extend his order, where are we?
Well, then we would have to go back and we would have to work with the towns and see what the mayors would be willing to sign off on, whether that means extending the order with fewer restrictions or not extending the order at all. And we need to work on that over the next few days, because again, our order expires in 7 days.
Right. So thank you for that. And I did get our county attorney's response to my question from last meeting about where the lines of authority are. And I appreciate that his answers to our question are consistent with what he told us last time. So if I can speak for a moment on this issue, we've been hearing, and I've been getting a lot of emails, I know everybody else has too, about this so-called movement to reopen the country. And I just have to say, we've heard so much from that side. We haven't heard enough from another side that I'm on, that this so-called movement has all the hallmarks of a political movement, a political rally pushed by familiar puppeteers who have now politicized our pandemic response. And it's relevant to this question of our stay-at-home order, because I believe that politics have entered into this decision, which should be predominantly a public health decision. And I just have to say that I believe this argument that we need to rush into reopening our economy, whatever those folks mean by that, what they're advocating is recklessness. And they can do that because they know that those of us, the rest of us, who will have to bail out the community when there is a surge of infection again, because we have opened too early, that we're all going to pay the price for it. So it's a very easy political argument to make, to simply reopen now. And what I think this has revealed is that we have a pretty significant hole in our emergency powers for public health. Think about this. The county is responsible for public health, and none of the municipalities have any capacity or responsibility relating to public health. I spent some time this afternoon looking at all the departments that each of the towns and the city have. None of them have any function relating to public health. And so it makes no sense that an entity that has no responsibility for public health can veto the entity that does have responsibility for public health in a public health emergency. And so I think this is a hole that we've got to fill. We've got to correct this, because it doesn't make any sense for municipalities to have veto power on public health issues vis-a-vis the county. And keep this in mind also, that we have a fully built function relating to public health. We heard today from our Deputy Director of Public Health, who is an epidemiologist. He talked about the data science teams that we're working with and the epidemiologists that we're working with. These are the professionals who we should be relying upon. And we have that ability, and the municipalities don't. So now, the fact of the matter is, we of course will have to lift the order eventually. But what I would like to know is, what will that process look like? What are the conditions upon which we're going to lift this order? And I would say that if we don't know what the governor is going to do, we're going to be dealing with this next week, because our order will expire. And you can only imagine that it's not going to be a soft opening. It's going to be a deluge. Everybody's going to come out. And what will we do then, particularly when we have a resurgence of infection because of that? So I just think we've got to we've got to do something about this, and I'm concerned about the fact that we have this uncertainty relating to when this order will be lifted. When I hear the public health director talk about the demographics relating to where COVID-19 is hitting, the best we can say is that it's uncertain. Thank you, Mr. Chairman.
Thank you, Mr. Fuller. Commissioner Scarborough. Commissioner Scarborough.
You can't hear me. Can you hear me now? Okay, I just said we have brought up a lot of issues. I think now I'm willing to just go ahead and work on what we put out there today, and also see if there's something that can be done. Because if we continue to put a lot of things out there, we're not going to get anything done. So I would be willing to work on a task force that would do that, because I think this stuff it's serious. I mean, we as a county can't afford to have what we have out there now. We cannot afford to have it. Hello?
Okay. Are you done, Commissioner Scarborough?
I'm done. I just think we talk too much. Let's do some action.
All right, thank you. Commissioner Harden.
Thank you. So my questions initially are for the public health director. So are there people, can you tell us who are the people that developed the models, and what are their qualifications and degrees and level of experience?
So the individuals that have developed the models that we've been working from, and the models come from a number of different places. And we've looked at a number of different models in the county. The two hospital systems have looked at models, and we've looked at models from the health department side as well. But we have come together on some modeling that we believe helps us understand what's going on in the county. There's the Washington model that many people have heard about, that really focuses on the number of deaths that you're seeing. We're not sure that really represents well what we're seeing in our community. There's the CHIME model out of Pennsylvania that we have focused on, that in some cases, some people believe is a little too extreme. So the models are all over the place. It's one of the challenges that we have. The folks that have worked on the models here locally include our epidemiology department in public health, which includes our deputy director, who is a PhD in epidemiology. But there's also data scientists from both hospital systems that have been working with us on these models as well. And although we've been using slightly different models, we've been willing to come together and agree on what we see in terms of projections.
Thank you. Are there any political factors that go into the models? We've been not accused, but there's been talk that the models are politically motivated. Their timing is politically motivated. Is there anything to that concern?
Not with the models that we looked at here in Mecklenburg County.
With the model that we're currently using, on the model today shows that there will be an increase in the rate of hospitalizations in the future. And like, for example, in the next 2 weeks, the model predicts an increase in a level of hospitalizations. Do you agree with that prediction?
We see some evidence that we are going to see increases in hospitalizations over the next couple of weeks. The model that we've been using shows that we have not reached our peak yet. And as I mentioned today, with the number of new cases that were reported today, it's one of the largest numbers in a single day that we've seen throughout this entire event. So, we are we continue to see the model flatten out some, which is keeping the numbers of hospitalizations down. They're not as severe as we had once thought they would be. But yes, we still expect increases in hospitalizations.
If there is increases in hospitalizations, is it fair to say that there'll be increases in the rate, there'll be increases in cases?
We expect to see, especially as we open up testing, which we hope we will be able to do in the fairly near future, we will definitely see additional cases. We recognize the fact that there are a lot more people in our community who are probably infected right now who are not aware and have not been tested.
So if in 2 weeks we're going to have increases in hospitalizations, and if in 2 weeks we're going to have increases in the number of cases, is it a recommended public health practice to lift restrictions in the community while we're undergoing increases in both hospitalizations and in cases?
I think we have to be very careful about how we open things back up again and when we open things back up again. I'm looking forward to the conversations that we're going to have over the next week about what that looks like and what the triggers are. And that's going to help us determine how quickly we can move with an opening. We recognize the impact that this is having on the economy and people in our community. So we want to be judicious about this. So I think the data will help us understand better what we can open up and when we can do that.
Okay, I'm gonna push you a little bit harder, Gibby, and I'm only doing this because I love you. Okay, I'm gonna ask again: is it a recommended public health best practice to reduce or lift restrictions while we are having increases in hospitalizations and increases in cases?
It is probably not a best public health practice to look at widely opening up again in our community. We still need social distancing and we need our stay-at-home order.
Thank you. I appreciate that. My next question is for Dina. And it relates to the responses to my questions as it related to the unemployment rate. So I'll just remind our audience that I made a request for data in terms of in Mecklenburg County. We know across the state, let me just start there. We know across the state that 630,000 people have filed for unemployment. And we know, the last reported numbers I saw were about 200 and something thousand were actually eligible for benefits. I had made the request to know how many people in Mecklenburg County made up those 630,000 people who have filed for unemployment claims, and then how many of those people are eligible. So again, I'm very concerned about people filing for unemployment and not being granted as eligible in Mecklenburg County. So you mentioned that we aren't able to get that data until May. Can we get an estimate, just maybe what an appropriate guess would be given on is there any way? I just feel very handicapped by not knowing how many people in our community have filed for unemployment and how many people are actually receiving unemployment.
Yeah, I think we all feel handicapped about that. I will tell you that we have asked for the information, and what we're being told is that the state has every resource available right now on processing those claims, and they're not in a position to provide us the data. As soon as we can get it, we'll provide it. I'm a little cautious about trying to estimate because I don't know what I'd be estimating on. We'll continue to push for it, but we cannot get that data by county. We just can't.
And I just know that we have a lot of economists, and we have an economist on our staff, and we have economists, that work for banks, and anyway, I hear what they're saying. I feel like we are the largest. I imagine that there are more unemployment. I'm just making an assumption that we have the largest number of unemployment claims in the state, but we just don't really know. And anyway, I just want to continue to. I'm saying this for public consumption too, is that I'm looking for solutions in terms of trying to figure out how we can better understand the level of unemployment in Mecklenburg County. So thank you for that, County Manager. I appreciate it. I don't have any further questions, Chairman.
Okay, thank you. Commissioner Mark Jarrell.
Thank you, Mr. Chairman. I appreciate it. And thank you all for your presentations this evening. I'm going to kind of work backwards on this one. I want to go to Anthony Trotman and the hotel situation that we were dealing with, and thank you for that update. I'm really concerned, and I really don't like feeling helpless when these kind of instances take place. I mean, we continue to see too many incidents where members of the community are really being preyed upon and disrespected in facing these kind of challenges that you're just not equipped to deal with. And I want to get a better understanding of the scope of the board's authority. And I guess this goes to either Tyrone or Dina, actually. So I apologize. But I want to get a better understanding at some point of the board's authority around implementing ordinances or some sort of measures to protect our residents from these incidences. It just seems to pop up all the time, and particularly as it relates to housing, which is so critical in the community. And Dean, I don't know if you can address that. Is that something that we can get our hands around to really understand what our scope of authority is around those ordinances or anything that we can put in place around these instances that we see?
Well, I mean, again, these are privately owned hotels, and they're technically landlords, and I guess technically they can evict them, but we're in a situation now where, we have parameters in place that prevent that from happening. But again, I mean, if people are living in extended stay hotels and they can't pay their rent, they can be evicted. And it's an unfortunate situation, which is why we need to continue to move forward with all of our affordable housing efforts to put people in places where they can be safe and not be preyed upon. But those are difficult situations. That's a longer look, and we can look at that, but we don't have a solution today, obviously.
Yeah, no, I get it. And I think I'm even expanding it beyond this hotel issue. I mean, we've had instances in the community with apartment complexes and other places where it seems to me and to a lot of people in the public and a lot of people we serve that certain people just get away with things that are dehumanizing and unethical. And the best that Mark Jarrell usually can do is say, unfortunately, I can't do anything about it. And so I just would like to get a better handle on if there is something that we can do about even beyond these hotel situations. But I certainly understand where you're coming from. So, Anthony, I do want to go to you because there's something. Did you say that we invest about $20 million when it comes to our homeless population?
That is correct.
So when we're looking at that, we had 3,700 approximately at one snapshot. So we're spending $5,400 per. Is that the right number that we should be at with our homeless population? I know that a lot of us are really concerned about the population, and I applaud the efforts that the team has implemented. But I'm curious to know if that 5,400 per or 5,500 per is the right number relative to other communities our size, and if we really want to tackle the problem.
Well, I don't have any comparison data with other communities right now, but I can say our community is a housing first community. So most of the new money goes to building and buying affordable housing units. That's the fund with the foundation, and that was the city's fund as well, the $50 million fund.
Mm-hmm. Gotcha. And I know you didn't touch on this, but I'm just curious. I was reading something about a change to SNAP. Is there anything that we can put out or are going to put out to the public around that?
Yes, we've released, I believe, 2 press releases on that, and I'll make sure I get you the information.
Thank you. I appreciate that. I want to focus on Gibby for just a second. I want to talk about our engagement into our vulnerable communities and want you to know that I appreciate that effort and the intentionality around that, particularly when we saw the numbers in the African-American community and our discussions around what we were seeing in the Hispanic community as well. How are we, Gibby, what are our measurements beyond just the biweekly reporting around the percentages of people that are impacted? Like, what other KPIs are we looking at to determine how effective our campaign is? I mean, obviously the percentages are going to be the major KPI, but what are those other KPIs that your team is measuring around effectiveness of the campaign, specifically in the vulnerable communities?
So a couple of things that we'll be doing. We do have a process where we're tracking social media to see how much we're getting out into the community with the social media messages. We're also working very actively with our faith community and looking for response back from them about how these messages are being accepted in the community and how we can change and improve those as we move forward. With the radio stations that we'll be working with, we've got like over 300 ads in the next 2 weeks that hopefully you'll be hearing if you listen to these radio stations, of course. And I can get those names to you if you're interested. They'll be letting us know what kind of metrics they have based on their listeners. They're also going to be posting information on their social media platforms for us, so we'll be getting that feedback as well. And we are doing some print and digital ads, and we'll get that information back too. And then lastly, just with the testing that's going on in the community, we're getting feedback daily from the testing sites on how well that's going and the feedback from the community on those.
All right.
Thank you, Gibby.
You're welcome. One of the things that will be hard to determine is how many cases we avoided by getting the messaging out. So we know how many cases we have now, but how many cases would we have had if we had not had this outreach and this marketing? And that's just really hard to track. But I understand what you're trying to get at.
Okay. Commissioner Leak. Commissioner Leak.
Can you hear?
Commissioner Leak.
Hello?
Okay, I can hear you now.
All right. I want to say thank you to the board members who have eloquently asked all of the questions that need to be asked. But some of the concerns that I have that they already spoke to would be my senior citizens, and especially the long-term centers where there seem to be the greater number of individuals. Gibby, are we now letting the county know where those sites are?
Yes, ma'am. We are posting the sites where we have active outbreaks. Every time we put data out, there is a list on the website at this point in time.
Well, let me thank you for your work and what you've done, and thank you. And I noticed you said in the beginning that the age range of those we have is 20 to 59 years of age. So we are not high in the numbers of seniors as of yet. Am I right?
So what we're seeing is about 70 to 80% of our positive cases have been in the 20 to 59 age range. The majority of the rest of them have been over 60.
Well, that's what I'm saying, that the greater number is not in the above 70. Am I right?
Exactly. Yes, ma'am.
All right. And you said we had 2 children?
Three now.
3 children. All right. What were their ages?
They were less than 1 year of age.
All right. Thank you. The statement made by Pat Cotham as related to the committees that we have, are we going to use that committee that assists and helps us with the long-term service and visitations? And I know they can't visit, but what can and how can they service you?
We will engage them tomorrow and have conversation with them about how they believe they can help. And as we understand more about what they do daily, we'll engage them in every way we can.
That sounds good. Now, testing, testing. Where will the testing be on the west side for the remainder of the 2 weeks?
Well, at this point, we have a standard location at the Northwest Health Department. Novant has their mobile unit there, and that's not moving. It's there every day. In addition, that's the main one. The other mobile, and then the one on Freedom Drive at the Michael Jordan Clinic.
So where will the others be on the west side?
There are 3 sites this week, and I don't have the addresses with me, but I will get those to you. The mobile unit, 3 different locations. So
I want to thank you for that, because the people are happy that we have them on the west side of town. And I think yesterday you were at the oldest Black church in the county, and that was Clinton Chapel in the Zion Church.
Mm-hmm.
Right. And you left for First Baptist West. That was great. So if we could get the names of the other sites that we're going to be seeing, hopefully for the next 2 weeks or longer, we would like to know and get that information out there.
I'll get those to you.
And thank you so much. Now, as we talk about our budget and how much the homeless cost us and how they suffer, and I think I heard Mr. Trotman say, how much are we paying for the homeless and trying to protect them based upon what their issues are? How much are we spending, Mr. Trotman?
Before COVID-19, we were spending around $20 million.
Is there any way that we could have put up permanent facilities with that kind of money? I guess we didn't have time to do it, but could we have, just to think about what we could have done had we worked earlier in that we did not know? What could we have done with that $20 million?
Well, the $20 million pays for operations of many different shelters. It pays for staffing. It also pays for housing, rapid rehousing and permanent supportive housing. We're moving people out of the shelters into housing units. So it's across the board.
But let me thank your team. Most of the questions have been answered. But as it relates to the federal legislation and the federal government and the funds that they're going to provide for the county, will that help us with our budget for this year? The money that we get from the federal government that will cover major aspects of this help that the community needs in terms of housing and food. Let me say, across this county, every section of the county, there are people who are dispersing food for our people. So can you help me there?
So Commissioner Leek, those dollars are for COVID-related expenses, and Starla can certainly jump in here, but it's my understanding, and we are tracking every dollar that we're spending on COVID-19, but we have to be able to justify that it's a COVID-19 expense to FEMA in order for us to be able to keep that money. Is that correct, Starla?
It is, Dina. This is Starla. Even if it's not FEMA money, even if it's coming from HHS or some of the other sources, they have a list of guidelines and requirements related to how the money can be used. And it is all COVID crisis related.
Will that money come directly to us or through the state?
Other than the one fund that I mentioned earlier, most of the funding, I say most because it keeps changing, but most of the funding will come through the state for the legislation that's been passed so far. Future bills could allow for additional funding that would come directly to the counties. We are certainly encouraging them to do that.
But I will say that we were one of 3 counties in the state of North Carolina that are getting money directly from the federal government and not through the state. That $41.5 million is coming directly from the federal government to Mecklenburg County. So we're very fortunate about that.
That's what I was thinking. I thought I heard that part, that money would come directly to us. The other question that I had as it relates to our persons who are incarcerated and seeing that they had moved some of our people to other parts. What about our jails here? Hello?
So our jail is remaining stable. As far as I know, there hasn't been any release of people in our jail. I will tell you, our sheriff has done an outstanding job of keeping COVID-19 out of our detention centers. He has been very engaged and very proactive, and he's been doing a tremendous job. So we are very fortunate that he's been at the helm during this crisis.
Well, I'm sure he's happy to hear that, and I want to also commend him. And I'm concerned also as we talk about our younger people who are confined. When they're talking about letting people go early.
Okay, Commissioner, your time has expired. Thank you. Commissioner Powell.
Can you hear me?
Yes.
Hello. Okay. The first thing that I want to say is thank you to Dina for organizing the Business Leader Roundtable. I think that this is a really important, positive step. It's critical as we think about moving forward. I would like to request a place for people to, like a certain email address for people to email their ideas and concerns, because we're all getting bombarded with different emails and sometimes we don't know exactly where to send it. So if we could get a specific email address for this roundtable to forward ideas from small business owners and others, it would be, I think that would be really helpful for the roundtable to be able to see what the community is sending to us. And it'd be nice for it to all go to one place. So I'd like to request that. And
great, we'll take care of that. That's a great idea.
Thank you. And I just, you know, when we saw that the peak date was going to be in June, it kind of took our breath away. And the first thing I could think is, how can we offer hope to the community? Because we all want the economy to reopen. Our number one priority is public health and safety, but we understand the importance of the economy. And so it's not like we don't care. We do care. We just have to be really smart about how we go forward to make sure that we are protecting public health and that we not only don't overwhelm our healthcare system, but that we don't cause unnecessary death for people we love. And so I think that this offers hope for people. They know that there is light at the end of the tunnel. We just need to be smart about how we get there. And I really appreciate it because I think it's a big sign of hope. The second thing is, I understand that you'd like a recommendation from the board to extend the stay-at-home order, and I'd like to request a written recommendation from emergency management for why this is necessary. And I think that's important because the public wants a detailed explanation of why public health decisions are being made the way they are. And I think if we provide that for them, they'll have an understanding of where we're coming from and how we are trying to protect public health in a smart way so that we can reopen the economy and have a healthy citizenry. And then I have a question for Mr. Trotman. about hygiene. Can you hear me?
Yes.
So thank you for all that you're doing. Can you tell us, I think you said that the mobile showers are not an option. Is that correct?
Yeah, they're not operating right now. It's just the showers at the Urban Ministry Center. And they're operating 7 days a week.
And people can go there to get a shower?
Yes, ma'am.
And they know how to find the transit to get there?
Yes, ma'am.
Okay. And how about, you see the big giant laundry trailers, sometimes Tide sponsors them. Do we have anything like that?
There is laundry facilities at Urban Ministry Center as well.
So everybody that needs a shower and laundry would have to go there?
Yes, currently.
Okay. And then the 12 alternate sites, have we placed the porta-johns and hand washing facilities at those 12 alternate sites that were identified?
No, we're working through that process currently. We were having conversations with Liz Kelly today about the contract process and the management of them. But we feel confident that we can move forward now.
Okay, thank you. Because I keep hearing about them, and I know some homeless people don't want where they live to be revealed, so I won't say the sites, but I emailed them forward so that everybody would see where they're requesting them. And I didn't get 12, but I'm glad you got 12.
Yes.
Okay, that ends my questions for now. Thank you.
Okay, thank you. Commissioner Susan Rodriguez McDowell.
Thank you, Mr. Chairman. Okay, first of all, I wanted to say congratulations to Michael Bryant on his promotion. I think that's fantastic, although I don't know who in the world could do the upside down and backwards explanations that he's able to do on the budget for us. And so that's going to be a challenge. But anyways, I just want to say congratulations to him. I also want to say welcome to Dr. Raynard Washington. I have appreciated his updates in addition to Gibby's. I think it's fantastic that we have such a great epidemiologist on the team. And so I want to say thank you for him being with us, and I look forward to meeting you. Now, as far as Dina, can you just, on your roundtable, is there a Latino, like the LACC, the Chamber of Commerce, are they included in that roundtable?
Yes, they are.
Okay, fantastic. And I want to say I really I support Mark Jarrell being chosen to be on that. I think he'll be an excellent representative for all of our voices on that roundtable. So I'm really appreciative that he's doing that. And I want to say thank you to our social work team that was able to assist the folks at the Days Inn. So Anthony, I appreciate that your folks are able to step in and help in that situation. And also for the porta-johns that we've requested. I thank you for working on those things. And I had a look at the new dashboard. I think if everyone who's, been concerned about the homeless situation, if you could check out this new dashboard that has been created specifically for the COVID-19 response to homelessness, I think it's outstanding. However, I do think that the number of homeless that you're citing seems extremely understated. And so that's going to be a bone of contention, I think, with our folks who are advocating for that population. And okay, so I wanted to move on and ask Dina, on your, I'm sorry, not Dina, well, Starla and Dina, I guess, on your presentation about the federal funds, these numbers, $500 billion for this and $4.3 billion for that. I know that we've got a direct allocation of $41.5 million. Is there some way that you all could provide a table or some sort of organized, structure on how those dollars would line up with our county expenditures and our anticipated expenditures? because those, it's just really hard to sort of sift through those numbers and make sense out of how they impact the county's budget. So if there's some way that you can, put a framework around that for us, I would really appreciate that.
Yeah, that's a great idea. We'll go back and try to put some stuff together, and we can share that. I think that's a great suggestion. So thank you.
Okay, thank you. I appreciate it. And so also I wanted to support Commissioner Powell's idea about the email address for the roundtable. And I think one of the things that our caller earlier today, she's from Pineville, Fonda Hill, one of her things that she said, which really stood out to me, is that all jobs are essential. And I think that it's really important for us to remember that. And so if there's a place that folks from all walks of life and all jobs, could have an input into that discussion, I think it really would be, quite a good thing for them. And so, but the thing that I really want to get down to, Dina, is this additional 2 weeks. Can you help me understand what will happen in those 2 weeks? Let's just say, we have 7 more days in our current order. And then we're thinking of asking the governor for 2 more weeks. What will take place during those 2 weeks? Because what I'm really, we really have to balance the fact that every week, every day, every hour is critical for people who need to work. And so I just think it would be super helpful if we could say, why do we need 2 weeks? Is it to flatten the curve more, or is it to organize the reopening phase in? Is it about trying to figure out how to reopen? Like what will we do with those 2 weeks that make them really important, both for public health and also for the economy? How does that magic 2 week number come about? Can you help me with that?
Sure. I think what I would say to your question is yes, yes, and yes. But I think one of the things that we know and to be able to reopen safely. Mm-hmm. I don't know that by May 15th we'll be there, but I think by May 15th we will have anything to add on that?
I would agree totally with that. We are working on both building up our ability to test and contact tracing, but some of that has to do with supplies, and the other has to do with just making sure that we've got staffing in place to be able to deal with the additional positive test results we have when we start doing more testing from a contact tracing standpoint.
Okay, I think the contact tracing sounds like a really important part that we haven't talked much about yet. And so I appreciate those comments. And I do have a couple more, but I'll wait for my second 3 minutes. Thank you, Mr. Chairman. That concludes the 7 minutes.
All right, thank you. I have a couple of questions. And again, all of you have asked some really important questions. No need for me to ask the same questions, but I do want to follow up on some of the things that were mentioned. First of all, as it relates to unemployment, I remember listening to the governor's new or extended orders the other day that allowed for people who had received a severance to now be eligible for unemployment. Is that in place now?
I'm not sure, but I can follow up. I don't know if Leslie, I know Leslie's on and Peter's on. I don't know if they have any more information on that. I do not, but I can follow up.
All right, thank you. The question came, and I think everybody will be interested in knowing this, is that the county rents these hotels Are there vacant beds that are not being occupied? And what, if anything, are we doing to make sure that those people who are homeless and don't have a bed can occupy those beds so that we get the best use out of our dollars?
So the answer to the question is yes, we do have vacant beds, and that is why we made the recommendation to allow the men's shelter as well as the Salvation Army's Shelter of Hope to move more people out of their shelters into our, allow them to take on some of the more vulnerable hotel for $20 million. But
$100 million.
Yeah, but you know, the population changes. And so when you buy a hotel for $100 million, you've got 120 units. We know that the need for housing is far greater than that. So, I mean, this goes back to the whole affordable housing conversation that we've been having, and what's the highest and best use of our money, and how do we create the most number of units that we can, regardless of the geography.
Yeah, that one gets me. What kind of support are we offering these nursing homes that have spread beyond just telling people what nursing home they are? Are we offering them any additional support?
Yes, we, number one, we're making sure that they have the personal protective equipment that their staff need to be able to
our homeless friends that that they can't do that, and they're closing early every day to do extra cleaning there, and so they can't use computers. They can't. So I guess I would just ask if you could get clarification on that. You don't have to give anything to me now, but if you could find that, that would be great. I'd like to talk about, I would like to know how many tents they have given out. It seems like they're giving out tents for like a one-person tent, because I've had some really tall guys contact me and say, you know, that this doesn't work. You know, they say like I'm 6'5", I can't fit in this. But I appreciate that. But I'd like to know how many tents they have given out. And I know we have a lot of tents near the urban ministry and the shelter. And like tonight, we're supposed to have some bad weather starting around 4 or 5 in the morning. And I just wondered about the safety of those tents and those people. So again, if you could just get back to me about, are those tents going to be able to support a heavy rain? You know, you also talked about, we talked about hotels a lot. I hope that sometime we can have a discussion about, you know, using hotels for short periods of time, especially like when the temperature dips to, you know, 20 degrees. I just ask us that we could, as a board, since we have had some luck with this, to, you know, look at that in the wintertime. I'd also ask Dina, I have heard from Mohammed Genetian of the hospitality, and I think he would like to be involved a little bit with the hotels, and so he has some great ideas. So I just point that out. Gibby, the last questions I had for you, and my time is about shot here, I would like to know about the other types of COVID fatalities we've had on suicides and overdoses. I've heard we've had a lot more overdoses and suicides, and I'd like to know about crime with domestic violence as people stay home, and some people are maybe drinking too much, and women or men are with their abuser. So I would just like at some point some follow up on that. And my time is coming up, so I'll stop. But thank you again for your presentation tonight.
Okay.
Thank you.
Did you want to respond to that?
We are anecdotally hearing about increases in all of those things that you mentioned, but I will work on pulling some data that may be available and get that to you.
Okay, Commissioner.
All right, thank you, Mr. Chairman. I think it is obvious that we will have to and will lift this stay-at-home order. That is obvious. But I want us to be as deliberate as we were coming into the order, coming out of it. And I just strenuously object to political pressure to have that happen. That's why my comments from earlier were so strong, because I think we ought to be ready when we come out. And if the facts are that we won't be ready by next week, that it would be irresponsible and reckless for us to come out of a stay-at-home order when we're not ready. So I fully understand the impact that it's having on our community and the need for us to restart our economy. This is going to go on for a while. We're not going to be done with this even when the stay-at-home order is lifted. We're not going to be done with COVID-19 for quite some months, I believe. Now, my question is, as we come out and there's a need for personal protective equipment and masks for just the general public, do we have any ability at the county level to help people source masks and various other protective equipment that, if we want to keep the gains that we've had during the stay-at-home order when we come out of it? And I would imagine that having masks, even as we go about our daily business, would be an important part of that. Do we have any ability to be able to help our community source those masks?
So I'm going to let Gibby answer that a little bit, but I can tell you that that's not something that we've been looking at, because we've spent all of our time trying to source PPE for our hospitals and our healthcare workers and our first responders and our county employees and our city employees. And we have not taken a broader look at what that would mean, but understand we have 1.2 million people that live in Mecklenburg County. So to be able to source that would be a very, very heavy lift. But I don't know if Gibby has any more intel or any information that she can provide on that topic.
Not really. Obviously we are recommending that people out in public who can't social distance wear masks, but we're recommending, we can't require, because we know there are a number of people who don't have access. That is a concern, but there are limitations. And right now, as the manager mentioned, we are needing to focus on those who are providing the care in our community with the resources that we do have available to us.
Yeah, and I do understand that. And I'm just thinking about that, you know, we might have a better ability as a county than an individual trying to go to all the Home Depots and all the Lowe's and wherever else you get masks. Just wonder if we could offer some help.
There are some efforts happening through the volunteer organization that's in the EOC. They are collecting some of those materials and making them available in the community. So I'll continue to work with them on that.
All right, thank you.
All right, Commissioner Harden.
Okay, let's see. Thank you. I appreciate, again, the conversation tonight. So, I want to double down on Commissioner Susan Rodriguez McDowell's comments about the appreciating the business roundtable and pulling that together. Have we given consideration to doing that for other aspects of our economy or populations that may be profoundly affected? You know, one of those populations, I think, is that senior population, and making sure that we know that we've got, at least from my perspective, we've got to do everything we can to make sure that our senior population is as protected, and that population, making sure their voices at the table, like the voices of seniors are at the table, I think are particularly important, because their voices are, I mean, they're literally locked down and behind doors right now. So that's one possibility for a potential roundtable. Another potential roundtable I could see is schools, because I mean, I'm trying to think about if we open up now, what does social distancing look like in schools? And how are we going to open up? And I don't know how that works. And I think that there's going to be a lot of concerns for families in my district as it relates to conversations about kids going back to school. And so can you speak to those two things, Gibby?
Sorry, I was muted.
That's okay.
I think there is, and there are a number of conversations that are happening in the community and in pockets. So there's been some conversations specifically around issues with the African-American community. There have been some conversations around specific issues with our elderly. The schools, I would imagine to some extent, are going to be driven by the state and the Division of Public Instruction. But we meet daily. I mean, we've got the school system represented in the Emergency Operations Center, and they're part of that conversation. So, I mean, moving forward, there are going to need to be more conversations about how we actually roll this out and what it looks like in our community. And I agree, having the voices at the table is going to be most helpful.
And then my last question is, following up on a point by Commissioner Powell, is the letter and the Chairman, may I finish my question, or?
Sure.
Thank you. Is the letter to the governor and that recommendation, is that supported by all of the members of the EOC, or is that coming from? Is that recommendation coming from you and the county manager, or whose voices are behind that recommendation?
Well, I will say that Gibby is the incident commander. So from a public health perspective, you know, her voice is really the main voice. But as we've been sitting on this meeting, I've been getting a lot of information about the governor is actually getting ready to announce his reopening plan tomorrow. So the time for a letter may have passed. So I'm actually going to withdraw my recommendation about sending a letter. And I think we need to wait to see what the governor comes out with tomorrow with his proposed reopening plan and then react to that. Because I think at this point, it might be a little bit too late. So
thank you.
Okay, Commissioner Jarrell.
Thank you, Mr. Chairman. Real quick, you know, I want to make a quick comment around the economic argument, and I don't think it can be overstated that our economic health is interconnected and interdependent on public health, and I hope people don't lose sight of that as we talk about you know, the economy. And so, particularly as though it and the health of the population are mutually exclusive. So, you know, I wanted to just set that up and say that as we move forward, and for us to think about that in the community. And the second thing I want to do is I want to talk about our seniors for a second. Commissioner Hardin alluded to the fact that you know, they're my words, isolated right now. And one of the things that I think we do really well is, you know, try to use technology to reach our population. But and I'm probably guilty of it more than most. But I am concerned about how we're reaching our seniors in our communication with our seniors and the support that our seniors are receiving now. And I know Commissioner Leak raises this constantly and champions this. Anthony, can you give us any sense of everything that we're doing or the high level items that we're doing to reach, communicate, and engage with our seniors? What are those programs and where can they find resources?
Well, we were operating congregate meal sites, but because of the social distancing order, we are delivering those meals to those seniors' homes. We also operate non-emergency medical transportation, and we are still taking seniors to medical appointments and other appointments that they need for their health. So those are two big things. We're still administering our feeding program as well as taking them to medical appointments.
Thank you for that. Dina, I want to make a suggestion for us to consider. I know a lot of our seniors still have landlines and things of that nature. It would be great if we could conduct, for lack of a better word, robocalls to them to provide updates and just to give information and make sure that they have resources. I think we could do it relatively cheaply, and we know that we would get a high contact rate by putting that information out as an alternative to email or just saying go to or hoping they go to a website.
We can certainly check and see how we can do that. Absolutely.
Thank you. Thank you, Mr. Chairman.
All right. Commissioner Leak.
I'm in agreement with Mr. Fuller on who's making the calls, and I heard my manager speak to the point that she feels that the governor will give his report on tomorrow. But I have to remind us that Black people have always been looking for jobs and out of work. So that's not new for some of us. So when you talk about economics, I'm wondering if we're talking about the whole rather than a part of our county. Are we going to make sure that this community is going to make sure that the poverty level is not 50% as it has always been the last several years in this community? Where is the wealth? And why are we still feeding on poverty with the wealth that we have in this community? So if someone can answer that for me, I would appreciate it. But the other thing that bothers me, as has been mentioned about my seniors, I myself am alone, but that's fine because I'm reading and writing and keeping up with what's going on. But as has been stated, many are not astute with the technology of today. So I have been advocating for senior, adopting a senior, or calling a senior within your community. that you know in your church. So I've been putting that information out throughout the community that we adopt a senior, or a senior then communicates with seniors within the community, and I hope that will happen. The other thing is asking, are there families in these hotels with children?
Anthony?
Hello?
Yes, there are families in the hotels with children. We did.
And the age, I'm sorry, go right ahead.
No, we took families from the Salvation Army Center of Hope. They're occupying a number of rooms in the social distancing hotel.
So there is good supervision, we hope.
Yes, it is. We have social workers there to provide support for them.
Thank you so much. And my last concern is talking about domestic violence that we have had an opportunity to know about that's rampant in our community, whether it's physical, whether it's verbal, or what have you. We must continue to fight that problem. I want to know if the crime rate has gone down because of this virus, if we know that. Who can answer that for me?
Well, I don't know the exact crime statistics, but it appears as if crime has been down since this has occurred. But we can get the stats for you from CMPD.
Well, I hope that we could, so we would know based upon what the figures are today. But again, let me say thank you for the work that all of us are doing and trying to get done. But I cannot see it becoming political where Republicans take the handle and move forward. At least I got that out. Okay, thank you.
Okay, thank you. Commissioner Powell.
Hi, this is Elaine. I was looking to see if Monica Allen was on the call because she teases me about saying everything's connected. And in this case, we can see that everything is connected. And I agree with Commissioner Fuller as well. This is a public health crisis, and politicizing a public health crisis is, and I don't say strong things like this, so I mean this. It is beyond despicable to try to politicize this. It's just beyond disturbing. We're trying to protect human health and safety. I want to thank all of the people who have worked so hard for the county. I've heard, I take every single communication I get from residents seriously. I try to understand their perspective and where they're coming from. And I've heard some really disrespectful comments about some of our staff, you know, what are they doing, as if they were bored at home or something. And I just want to say a special thank you to people who have gone above and beyond for the past many weeks, including the, emergency management team, but a lot of people working from home in situations that they've never worked in before, working well beyond, what's required just to get through this state of emergency. But especially to the solid waste employees for the county who have had record numbers of people coming in with solid waste, and they show up and they handle it, and nobody ever thanks them. And I am thankful for them because they're there and they're working on a skeleton crew. They're minus some people and they're still working. And same for park rangers. People act like we have a multitude of park rangers. Today we have 39 park rangers servicing all the parks, which are open. And so if we had a multitude excess of, park employees, I'm sure that they would be happy to police the parking lots, but we don't have a multitude. We're working on a skeleton crew. And there are other areas, social services, school nurses, all these wonderful people showing up to work through a state of emergency. And I think it's important for us to recognize that these people are stepping up. And so it's really hard for me to hear comments like, what are they doing? They're working hard and they're trying to get all of us through this emergency. And I also wanted to say something about our healthcare. Is my time up? Our healthcare system, Atrium and Novant, while we are focused on the state of emergency and treating COVID patients, I hope we're not weakening the infrastructure of what we had prior to this emergency. We need to make sure that we're taking care of the people. And I was thinking of this. But we just need to make sure we don't weaken the infrastructure. I'm getting many emails from people saying that they've been laid off. And I think, I can't believe that people are getting laid off in this time of crisis. So please pay attention to the infrastructure. Make sure we don't weaken it. Thank you. That ends my comments.
Okay, Commissioner.
I just want to thank Commissioner Powell for recognizing our county employees who are working extremely hard. Even though they're working at home, they are stepping up in remarkable ways, continuing to serve this community. So thank you, Commissioner Powell, for recognizing them.
All right, Commissioner McDowell.
Thank you, Mr. Chairman. I want to echo what my colleagues have said, especially Commissioner Fuller. I really want to say that I recognize, and obviously we're all getting this avalanche of emails from, there's a really despicable political movement going on it's politicizing a public health emergency, and I do find that despicable. But there's also this other side. I see that there is another side of profoundly suffering group of paycheck to paycheck people who are panicked by a broken system. Our federal government is failing us. And so many things at the state and federal level, like people can't get through with their phone calls to unemployment, and people can't get help. And so I think I really want to balance, the folks that are writing to us because they're profoundly suffering and scared. And then there's this other group that is just lambasting us for ripping up the Constitution and all this kind of stuff. I really want to make sure that we're not lumping them all into the same category, because I think it's different. But having said that, I really do believe that our federal government has failed us so much in so many ways. But in one of the most profound ways is with the PPE supply. And so as we look toward reopening and over whether it's the next 1 week, 2 weeks, whatever, one way or another, this PPE shortage is going to be profound for our whole country. And so as we reopen, we know we're going to have to keep safeguards in place. So my question is to the county, is there anything that we can do as a county? Can we create or find, I guess we don't create companies, but can we find a company of, maybe low-skilled workers who need a job that could make our own PPE not for medical use, but for business use, for customer use, for all of those essential, because we know every job is essential to someone. For all of those jobs where people are going to need to wear a mask or just in daily living, for schools. So we're just going to need a profound number. What can we be doing to ramp up that supply? Because we can't sit around and wait for the federal government. They're failing us. That's the end of my comments. And that is a question if Dina has an answer.
Well, that's a great question. And, I know our emergency management team is working really, really hard to try to source PPE. To your question about whether or not we can create our own supply chain to be able to create PPE, that would require some additional thought. I think it's a great question. We would need to think about it a little bit more. I don't have a really good answer, but I think it's a great question.
Thank you. And thank you, Mr. Chairman. That concludes my comments.
Okay, thank you. Commissioner Scarborough.
I'm done. I have I appreciate the comments that were made, and I think that they're very well on point, and we just need to keep marching.
Okay, thank you. Just a couple of things. Let me share with the board that I have been in conversation with the chair of the school board. She sent me some information earlier today. I haven't had an opportunity to read, but I can tell you that they have the concern as well if, in fact, the schools are going to open up this year or wait till next year, because if they open up, they have a real serious problem with social distancing within the classroom, given the number of students that's in the classroom. So that's a big concern. I've also spoken with the county manager about beginning to set up a plan for how we come out of this and how we open up our county. I agree that this whole issue has been politicized, and we should not allow that to be the guide that helps us make decisions. That we are responsible for the health and welfare of every citizen in Mecklenburg County. I do, however, understand some of the questions that have been raised, and I hope that at the appropriate time, we can start loosening up some things. For example, some of you have gotten these questions about tennis. I know tennis players are upset that golfers play golf and they can't play tennis. And whether or not that's one of those things that can be done responsibly. There are probably some other things. And so I hope to the degree that the committee that evaluates this will really seriously look at some of these things that come to us, because some actually come with a plan. And whether we like it or not, the new normal is going to mean that people are going to operate in this fashion. There's just a lot going on. My biggest concern is until everybody who wants to be tested can be tested, we have a problem, because we don't know if people can't get the test that their desires. It breaks my heart to hear that people could not go get a test, and as they sit home waiting to get sick enough so that they could qualify to get a test, they were so sick that they died as a result of it. And that hurts. I'm done.
Thank you, Mr. Chairman. That concludes the manager's report as it relates to COVID-19. We do have some fee adjustments that we need for you to be aware of as we move into FY21 budget. As you know, I will be presenting my budget next Friday, and fee increases are part of that. This is not something that you need to vote on, but we certainly want you to be made aware of that. And so we have some fee adjustment proposals from Louisa and from the Health Department. And I believe we will start with the Health Department.
Yes, ma'am. We have several fee adjustments that we're requesting. The first, it has to do with our dwelling-led investigations. These are investigations that are done by our Environmental Health Department. You can see a pretty significant jump from the current fee to the requested fee. The point that I want to make here is that this is the fee that is charged to Medicaid. The requested fee is the amount that Medicaid will pay for this effort. We do not send a bill for these services to the individuals when we are doing these investigations. And this puts us in line with both Wake and Durham County that have increased their fees to match this amount. There's quite a bit that goes into these investigations. It's not just a specific dwelling. What happens is when a child is tested positive for lead, then we go into the home, but we also go into the other environments where this child spends time to evaluate where that lead may be coming from. So the request is to increase that fee to $1,200 for a specific investigation. Should I go through all of these?
Yes, we're going to go through all of the fees and then allow for questions on any one of the fees.
Okay. So the next one is commercial pools plan review fee. Again, we're asking for a $100 increase in this fee from $250 to $350. And that fee, again, is in line with what others are doing in the state. There's an increase in complexity and the amount of time that's required to do these plan reviews. These are for new pools. And so that's the reason for that request. The TB risk assessment attestation, this is a new fee for us. This past year, there was an inability to access the serum that we use to test people for TB. That's the little prick under the arm to test whether they have been exposed to TB. And CDC made changes in their recommendations on who needed to be tested because of the lack of availability of that serum. And those recommendations included moving to a questionnaire, a screening questionnaire, and then an attestation letter if that screening was negative, rather than actually testing people. So we went through that process. That serum is more available now, but CDC continues to recommend that anybody who is at low risk not be tested, not be screened, but actually has the questionnaire done, and then we do an attestation letter. There are a number of people that need this for their employer. School teachers are ones that have always been expected to be screened, but there are a number of other employers that are requiring that as well, but they are accepting the letter. So we're looking at charging a fee for that. We've been doing it at no cost, but it does take staff time to do the screening and the letter. The next two are drugs that we currently provide through our pharmacy. One is the emergency contraceptive, and that's through family planning. The other is the meconazole vaginal cream, and that is an antifungal for yeast infections that we provide through our STD clinic. We get those drugs through 340B, which allows us to have a reduced rate for that. And it's just a vendor pass-through, but we need to have the fee documented to be able to access these drugs through 340B. And that's the request for those two. I'd be happy to answer any questions.
And answer any questions. I think we're ready to move on to Louisa.
This is Commissioner Powell. I do have a question or a few questions.
Okay, we're gonna wait to the end and answer all the questions.
Okay.
All right. Thank you.
Yeah, thank you, commissioners. Can you hear me?
Yes.
Yeah, this is Ebenezer here again. Good evening. Thank you for this opportunity to present. Very briefly, I'm going to walk you through Louisa's fee proposal. We have requests from two divisions. One is stormwater and one is solid waste. As you're aware, both of these are completely fee funded. We don't receive any property tax revenue to support these operations. Next slide, please. I can go to the next slide. Yeah, the stormwater fee, if you remember, some of this may look familiar to you. Last year, we had come to the board with a one-step increase, and the board recommended that we go to a 2-year phase-in. So this is year 2 of the 2-year phase-in. So I'm just calling it to your attention. Again, this has been reviewed and approved by the Stormwater Advisory Committee. And this fee last year, as we proposed, was based on 100% cost recovery. This fee, what we are proposing, is not the fee charged to all the residents. Rather, this is a fee paid by those that come, the developers and the architects, engineers that come and submit plans to us. This is a plan review fee adjustment. Can we go to the next slide? That recovers our cost to provide these services for these various kinds of activities that stormwater provides for the 5 towns, not excluding Huntersville. So if you see, we had recommended a single step jump, but the board recommended last year, and we agreed to a 2-year process. So some of this may look familiar. Nothing has changed since what we proposed to you last year. The next slide, please. As you can see, some of these projects, although they are $1 to $10 million, the fee only go up by about $150 and so on and so forth. That was based on an analysis done by collecting all the costs that we incur in providing this service. And over 2 years, we have estimated that this is our cost to be able to do a thorough review and respond to the applicants. And so that is it for the stormwater fee. Next slide, please. We go to the solid waste proposed fee adjustments. Again, this solid waste fee adjustments have been approved and reviewed and approved by the Waste Management Advisory Board. One of the things you will see here is we are requesting a 3-position enhancement. I will explain to you why we need those positions for next year. This is also part of our strategy to align fee with the cost of service. As you know and well aware, our cost of providing services, especially in the solid waste arena, has continued to increase, while the revenue from the global recycling issues has been either lower or steady at best. Plus, we also have some major capital needs coming up this coming year for both at the Foxhole landfill and the material recovery facility. And we have the new contract that the board approved for the MRF operation in place as well. Next slide, please. The three positions that we are requesting is one for a solid waste project manager, which is going to be fully fee funded. This is to manage some of the projects that are going to come online next year. An environmental supervisor, and an M&O stands for maintenance and operations specialist. All are fee funded positions. Next slide, please. This is just a short summary of why we need those positions. We have new infrastructure projects that we intend to do this coming year. The supervisor will help us with the collection activities at the CPCC, CMS, and other partners. If you remember last year, we brought that operation in-house from a contracted service, and the maintenance and operations specialist will also help with the collection efforts. We have one of the capital projects we have is about a 17-acre expansion of the cell at Foxhole. As you may be aware, we are nearing capacity on the existing cells, so we have to continue to expand in phases. And the other enhancement also includes traffic enhancement at North Meck, where we are planning to build a new exit road that would lead by the CPCC campus, so that the in and out will not be on Statesville Road and will provide us a better traffic pattern at that site. Next slide, please. Some of the other capital intensive plan we have for the next year is the acquisition of about 10 acres of land in the Steel Creek area. If you remember last year, we presented a plan that said that particular area doesn't have a full service drop-off center. So we have identified a parcel that we intend to purchase and then build. Then also we are partnering with Park and Rec to acquire about 27 acres of property by the old Holbrook landfill in the Huntersville area to not only provide a buffer for the closed landfill, but also Park would be able to use the rest of the area for a future, for some future use. We also are intending to do about almost $8 million worth of upgrades at our material recovery facility. Most of the equipment we have is coming to the end of life. So we are due to replace some of that heavy equipment to continue our operation there, as well as lease about 5 acres of the durable wood site right next to the Hickory Grove to help streamline our operations at that location. Next slide, please. So the fee adjustments, again, this is continuing the historical trend that we've seen, about 50 cents a month per property for the residential availability fee. That is about $6 annual increase. This is what pays for some of the operations at the full service recycling centers. And just to give you a context, we typically see 500 to 600 customers at the site. Now with the shutdown and stay at home, we're seeing a little over 1,000 customers at the site every day. So our cost to operate those sites continues to go up. And the Speedway landfill tip fee increases by $1.10 a ton. This is paid for by the city and the other towns that dispose of at that location. This is just, it's a pass-through, it's a contractual rate increase, as well as the construction debris tip fee is we are proposing to increase by $1.50 a ton at Foxhole, and the other location, which links to $51 a ton, which is still comparable to what the surrounding facilities around us are charging. That will help us with some of the increased costs at Foxhole and other locations. Next slide, please. We continue to experience challenges in the waste tire fund. Usually the state is the one that provides some of the fees, but we are running about a $300,000 deficit because there is not much revenue at the state to pass on. While we continue to see increased costs with electronic waste, as you remember a couple of years ago, we spoke about televisions. And we have also instituted a change in the glass collection protocol to reduce some of the processing costs. So therefore, we continue to look at our operations, continue to refine and streamline. But we think with some of these fee adjustments, we'll be able to fund the necessary infrastructure improvements to help us continue the progress we made thus far. I think that ends my presentation.
Madam Manager, is that it?
Yeah, that's it. If there's any questions, we'll be happy to take them.
Okay, so before we start questioning, let's put some parameters around this. It is not going to be voted on tonight. Some people might have more questions than others. So, Madam Clerk, a maximum of 5 minutes if there ought to be questions, but given that we're not voting on this tonight, there may not be as many, but if people do ask questions, a maximum of 5. So we'll start with Commissioner Cotham.
Thank you, Mr. Chairman. Thank you, Ebenezer, for that presentation and the previous presentation also. I really wanted to, I certainly remember last year when we, and I thought it was a good move that we asked for a phase-in of these fees instead of just over 1 year, over 2 years. And I thought that was a wise decision. However, last year we did not know that this year we would be in this time of uncertainty and in this pandemic, and we don't really know what our future is in the next few months. So I would ask you, Ebenezer, if you and your team would discuss the stormwater fees with the developers and the associations. I can't say the REBIC and the commercial and all the developers, and talk to them. And I would ask you to consider giving a 1 year reprieve on this and push it out another year on that, just because we certainly didn't know this last year. So I just ask you to, make a good faith effort to talk to them, and because they are struggling, and this, especially with our developers that are building affordable housing, and every dollar, every penny counts, and they are just in a difficult situation. A lot of them are. So I just ask you to think about that and consider talking about that. I trust you. You've been, you and your team and county manager have been good over the years as we go through these type of issues, and just to see what makes sense for these folks. And I really don't have a, Gibby, thank you for your presentation, and thank you for explaining some of those things that sometimes, especially the general public listening to us, they don't understand how some of those things work. And this is a more complicated part. But again, those are my comments, and thank you very much.
Okay, Commissioner. Commissioner Fuller?
Oh, yes. Thank you. Sorry, I was on mute. Some may have preferred that. Anyway, I just want to ask Gibby about these fees, particularly the ones relating to TB, risk assessment, the emergency contraceptive, and the vaginal creams. Are these fees that are going to be paid by individuals?
No, they are. So the 340B, the last two fees are fees for services that we do. I mean, things that we do provide through our pharmacy. The charge is not passed on to the clients unless, of course, they have health insurance, which is very few of the people that we see. But we do have to have the fee charge to be able to access those through 340B. So that the charge has to be on the books. The TB one, the $20, yes, we do pass that on to the individuals that come in that need that. They don't have to get that from us. They can get it other places in the community, but I would think that our charge is much less than how they would access that anywhere else.
And what, how many people are generally accessing these services that these fees would cover?
That is a good question. I don't have those specific numbers. I can get those for you. I know depending, at the beginning of the school year when teachers are having to get that certification around TB, we have quite a few people coming in. And there are times when some of our businesses are hiring large numbers of people. They'll have a large number coming in, but it's in fits and starts. The two that are through the STD clinic and the family planning clinic, the STD medication, we probably use that very frequently. the other much less frequently. But I can get specific numbers for you if you'd like.
Yeah, especially on the TB one, because my thought is, if not many, if there's not that many people accessing it, such that we could avoid charging a cost for it. For example, if it only represents, $10,000 in a year, maybe we can get away with not charging that fee. And I just ask that we think about it.
Absolutely. I'll take a look at that.
All right. Thank you. Those are the questions. Oh, and I would just say on the fees that Ebenezer talked about, I do think that we should proceed with the plan that we had, the phase 2 plan. I think the only thing I think about is if we delay it, there will be something else next year. And I think we should just continue with our plan. Let's be mindful, particularly for those developers who are in affordable housing. I think we have room to do some things to help ameliorate fees in those particular situations. But I do think we need to follow through on the commitment we made last year. So thank you very much. That's the end of my comments. Thank you, Mr. Chairman.
Okay, Commissioner Harden.
I don't have any questions at this time.
Thank you. Commissioner Jarrell.
I'm good right now, Mr. Chairman.
Thank you. Commissioner Leak.
About the emergency contraceptive one. Is that 1882? Hello?
Yes, ma'am.
Is that 1882? Is that for an examination? What does that entail?
That's a medication that individuals can take. It comes through our pharmacy.
All right, so they don't have to pay for it, right?
No, ma'am. They're not paying for it.
All right, then. Thank you. That was my question. And as it relates to Ebenezer, my question is, the large grocery stores, do they pay a fee for building? Do we have to are they charged a fee? So they're building buildings to house their building.
Commissioner Leak, yes, they do. Actually, they hire either an architect or an engineering firm to do design for them. So the architect engineer firm, the fee they give them pays for the fee as well. So yes, they do through their architect engineer.
All right. I'll have some other questions with you later, but thank you so much. I needed that question answered. Thank you.
Okay, Commissioner Powell.
Hello. I had the exact same questions as Commissioner Fuller. Gibby, can you just tell all of us about the TB recommendations, like more in detail about who comes forward with this?
So what we have done for years is there are a number of people that work in healthcare industry, people that work in schools, and a number of other venues that they're required to have a TB skin test once a year just to make sure that they're not infected and that they've not been exposed. And they come into the department and we do the TB skin test, and they come back 2 days later and we read it and it's negative, and they get a card that says they passed the test, and they take that back to their employer. This past year, over the past couple of years, CDC has recommended that those are not necessarily something that we need to continue to do. They've recommended that actually implementing a screening questionnaire to determine whether somebody is at risk for TB, and then we do need to screen, or if they're low risk, they don't need that. And then this past year, we actually had a shortage of the serum that's used to do that skin test. And they strongly recommended that we stop doing that unless we find somebody that's high risk. So we implemented that this last year, and we have been doing those over the past year with no charge. The thought was, if we're going to continue in that vein, because if we did a TB skin test, we would be charging. So what we are doing is just putting a small fee out there for individuals that have to have something to take back to an employer which we can do through the screening questionnaire and give them a letter, and that suffices with their employer for them for the following year. So that's what the fee is for, is just an opportunity to cover some of the cost that goes into that visit.
I have the same concern Commissioner Fuller has. It's such a public health issue. And I know in one of your COVID updates, you also gave a TV update. And yeah, and so for whatever we can do as a county to make people who are at risk and who do have a positive PPD get follow-up, I just have concerns about charging.
Okay.
So if we could get some more information on that one. And then, thank you. And for the stormwater fees, I agree with Commissioner Fuller. I think the phase 2, we just need to go forward. I think that if you remember last year, I voted no because I felt like we should have gone forward altogether. And I think that we've been more than gracious for many years and absorbing the cost for a long time. And so I think we should just go ahead with phase 2. And on the solid waste request, I agree with every single one of them. And I don't know how many of my colleagues know that I served on the Solid Waste Advisory Board for 9 years at one point in my life. And so when they come forward with a request, the Advisory Board has reviewed it, and I've reviewed all the recommendations, and we need them. So my only concern is that one TB charge. That concludes my comments, Chairman.
Okay, Commissioner Susan Rodriguez-McDowell.
Thank you, Mr. Chairman. It seems like we are all thinking the same thing about those fees from the health department. But I do want to make sure that we're not being tone deaf in raising the cost at this time. So I appreciate if we take a second look, especially at the TB risk assessment, if that's actually coming out of somebody's pocket. If it's $20 when you don't have a paycheck and, you're trying to get back on your feet, I think, that is a factor for people. So that's one thing. And then I just wanted to ask on the foxhole construction debris, Ebenezer, I'm just looking at the $1.59 a ton that jumps up to $51 a ton is such a huge jump. Can you just say how many tons are a typical load? Is that one visit?
Yes, Commissioner. Actually, typically it just depends on the size. A small block of concrete can be a lot, whereas a lot of this other construction debris, like, the smaller material may weigh less. This is actually very much in line or even slightly lesser than the other C&D landfills that are around us, not only in Mecklenburg County, but also in South Carolina.
Okay. And then one last question about the waste tire fund. It's a $300,000 shortfall. And did I notice that you mentioned that it was due to a state shortfall in underfunding? Is that something that we can get money back from at some point?
Thank you for that question, Commissioner. Usually what happens is whenever you change tires, if you remember, they charge you like a waste tire recycling fee. That all is collected by the state and it flows back. A couple of years ago, the state changed the formula. Instead of per tire, they did it based on a value, because of which the state is collecting less money than it previously did. And so the reimbursement has dropped because of that. And so we continue to work with the state to get as much as we possibly can, but it appears the state is also collecting less money because of the way the formula was changed a couple of years ago. We are working with our friends and partners throughout the state trying to see what can be done, but that's the current status.
All right, thank you. That's the conclusion of my questions, Mr. Chairman.
Okay, Commissioner Scarborough.
I have no additional questions. However, I have appreciated the information that I've been getting from all of you, because some of the stuff is above my head.
All right.
No questions.
All right, thank you. Just briefly, Ebenezer, I agree with everybody else. I think we ought to go forward, because if we delay the 2-year plan, I thought it was a 3-year plan. Whatever the plan was, then it'll be something else next year. But I do have some concerns. For example, you're proposing an increase in the residential availability fee. Modest increase. What concerns people is when they pay that in property tax and then go to the landfill and have to pay again to dump. So can that fee not just be one place?
Sorry.
Yeah.
Thank you, Commissioner, for that question. I think it's a great question. What we've done is every resident has the ability to dump for free, but there is a quantity limitation in the sense that, for example, if somebody brings stuff in their car, in their trunk, that they want to drop it off, or in the back of their pickup truck, most likely it is free. There are some that bring with a trailer full of stuff, because there are even some small commercial guys that go around and clean up garages, etc., that actually charge the owner to clear it up and disposal, and those are the extra material that have to pay when they come and get it weighed at the site. If you're a resident, 2 bags of trash is free. A television you can drop off for free. An amount of paint is free, etc. So the citizen has access to it to drop off smaller quantities. If they choose to, they can come every day as long as the quantity is limited. It is when you exceed a certain quantity or a size of a vehicle, then you're asked to pay by weight.
Okay, well, maybe that's not clear to the people who are charging. And I've been a victim of that. I've been charged several times at the weight station for taking stuff that I'm disposing at home, and it burns me that I pay a fee and then have to go pay another fee to dump. So maybe we need to look at that and make sure that people are being charged appropriately, or that people should not be charged a second time simply because they're dumping at the waste dump.
Sure. Apologize for that, but I'll find out what's going on. I'll get with you later, Commissioner, to see which location that is, okay?
Oh, well, I can tell you it's the one up in Huntersville. But aside from that, while I'm not concerned so much about the proposed increases, even though I think they're substantial, I think we need to do an audit to make sure that the fees that we're charging actually cover the cost of doing business and that there's no extra money. Because that's a big jump. And in line with that, with these new positions, I'm assuming that we're covering the cost of these new positions with the increases, as well as the $8 million that we need to refurbish stuff. Is that cost?
Yes, Commissioner. What happens is, again, if you remember, we've about 3-4 years ago, we presented a long-term kind of a plan to the board that said these are the things we have to do in the next 5 to 10 years. So some of these fees we also have banked over time. So we have built up the fund balance to be able to pay for these. For example, the 17-acre expansion at Foxhole would cost almost $7 to $8 million as well. And so all that money, we have to plan ahead to make sure we are banking enough. We'd be more than happy to work with the county manager to do an audit and see what our full cost of service is. Plus also we have to project forward because we don't get any property tax money to pay for the capital project. Solid waste is an enterprise fund that pays, that collects fees, and the money has to be spent on solid waste activities.
Right, and I get that. And the last question deals with, we're purchasing land. Is the cost of that land also coming out of these fees?
Yes, sir.
Okay. All right. That ends our questioning. And so at this time, we will move to our consent agenda. The first thing we need to do is to get a motion to approve the remaining consent agenda items that are now on the list. Is there such a motion?
So moved.
By who was that?
Commissioner Hardin.
Moved by Commissioner Harding.
Seconded by Commissioner Rodriguez McDowell.
Okay, it's been moved by Commissioner Harding, seconded by Commissioner Susan Rodriguez McDowell. Okay, I'll conduct the roll call vote. Commissioner Cotham. Commissioner Cotham. All right. Aye. Commissioner Fuller.
Aye.
Commissioner Hardin.
Aye.
Commissioner Jarrell.
Aye.
Commissioner Leak.
Yes.
Commissioner Powell.
Aye.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
And the chair votes yes. Madam Clerk, would you read the results?
That was a unanimous yes vote.
Okay. So at this time, we'll move to the items that were pulled. We'll start with Commissioner Jarrell, pulled item 6063.
Thank you, Mr. Chairman. Just really quickly, we've already actioned this item, and it's just a slight change to it. But I wanted to take a second again to say thank you to staff who really made this happen. This endeavor is really, really important to the community. This family is greatly appreciative. It was a young life taken too soon, and I want to thank my colleagues for supporting this because of the uniqueness of the situation. And again, I couldn't let the opportunity pass without thanking everyone, our Park and Rec Commission, our Park and Rec Director and team, and of course, you, my colleagues. So thank you very much on behalf of the family and the residents of NODA community who really rallied behind this effort. So again, I just did not want the opportunity to pass without saying thank you. So moved, Mr. Chairman.
Okay, is there a second?
Second. Scarborough, second.
Okay, so it's been moved by Commissioner Jarrell, seconded by Commissioner Scarborough. I'll conduct the roll call vote. Commissioner Cotham.
Aye.
Commissioner Fuller.
Aye.
Commissioner Hardin.
Aye.
Commissioner Jarrell.
Aye.
Commissioner Leak.
Yes.
Commissioner Powell.
Yes.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
And the chair votes aye. Madam Clerk, the results.
That was a unanimous yes vote.
All right. So we'll move to the next item, pulled by Commissioner Leak, item 6064, public auction of disposal of surplus equipment. Commissioner Leak.
Thank you. I pulled this because there have been many questions asked about how do we get rid of those items that's no longer available or useful for the county. And this will give people an opportunity to check on the cost and what's available, what equipment is available that would be disposable for the community. So moved, Mr. Chairman.
Okay, moved by Commissioner Leak. Is there a second?
Second, this is Commissioner Jarrell.
Okay, moved by Commissioner Leak, seconded by Commissioner Jarrell. I'll conduct a roll call vote. Commissioner Cotham.
Aye.
Commissioner Fuller.
Aye.
Commissioner Hardin.
Aye.
Commissioner Jarrell.
Aye.
Commissioner Powell.
Aye.
Commissioner McDowell.
Aye.
Commissioner Scarborough.
Aye.
And the chair votes aye. Madam Clerk.
I didn't get Ms. Leak's vote.
Commissioner Leak, would you like to repeat your vote?
I said aye.
Thank you. Then that's a unanimous yes vote.
All right. Thank you. The next item is item 6072. Construction easement pulled by Commissioner Leak.
On this one, it says temporary construction easement, Long Creek Greenway and Stream restoration project. This is providing for there to be support of the trustee board of a church, and that's Temple Baptist Church in West Charlotte, and they're donating the easement process. So I'm in favor of us doing this. So move, Mr. Chairman.
Okay. Moved by Commissioner Leak. Is there a second?
I second Scarborough.
Okay, moved by Commissioner Leak, seconded by Commissioner Scarborough. The roll call vote, Commissioner Cotham.
Aye.
Commissioner Fuller.
Aye.
Commissioner Harden.
Aye.
Commissioner Jarrell.
Aye.
Commissioner Powell.
Aye.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
The chair votes yes. Madam Clerk?
That's a unanimous yes vote.
Okay, thank you. The next item is item 6073, land donation, West Tybola Road property pulled by Commissioner Lee. Commissioner Lee.
Yes, thank you. This is right in the part of District 2, and it deals specifically with some property that is owned a parcel. I'm not sure how this parcel is going to be used, so I need somebody to tell me.
So Commissioner Lee, we are not sure what this parcel will be used for, but it is a land donation and we will accept it and we will evaluate what our future purposes may be.
Well, could you tell me this? Will this enhance the York Mount and Springfield Parks?
Not necessarily. We still have to evaluate.
All right, then. So move, Mr. Chairman.
Okay. Moved by Commissioner Leak, seconded by Commissioner Scarborough. The roll call vote, Commissioner Cotham.
Aye.
Commissioner Fuller.
Aye.
Commissioner Harden.
Aye.
Commissioner Jarrell.
Yes.
Commissioner Leak.
Yes.
Commissioner Powell.
Aye.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
The chair votes aye. Madam Clerk.
That's a unanimous yes vote.
All right. Moving to item 6076, easement donation, Paul Creek, pulled by Commissioner Lee. Commissioner Lee.
Yes. Thank you. This again deals with donation of property that will afford the community of Paul Creek Village Homeowners Association to move forward. So move, Mr. Chairman. It will be by the Greenway.
Okay, moved by Commissioner Leak. Is there a second?
Second Scarborough.
Okay, moved by Commissioner Leak, seconded by Commissioner Scarborough. Commissioner Cotham, how do you vote?
Aye.
Commissioner Fuller.
Aye.
Commissioner Harden.
Aye.
Commissioner Jarrell.
Aye.
Commissioner Powell.
Aye.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
The chair votes aye. Madam Clerk?
A unanimous vote.
Okay, the next item is item 6090, grant application, criminal justice housing and client engagement, COVID-19 response plan from Criminal Justice Services, pulled by Commissioner Lee.
Yes, this deals with the question of where will the funds come from? They're asking for a grant. Is that from the federal government or is that from where? Where will those funds come from?
That would be from the federal government, Commissioner Lee.
From where now?
Actually, I'm going to rephrase that. It's from Cardinal Innovations.
It's coming from Cardinal, and what is that? What is Cardinal Innovations?
Cardinal Innovations is our managed care organization for behavioral health services. And what this would do would be to provide services to those who are being released from prison during the COVID-19 epidemic and allow them the ability to access services in the community.
This is the insurance group, right? It's
Yes,
owned
it
by
is.
the state.
Correct. It's
So
federal money.
So the fund, they would do the treatment and all that, am I right?
Well, it's really more for things that will allow them to access cell phones and other things that will allow them to keep in touch with their local caseworkers here.
That works for Cardinal.
Correct. Well, the funding would come from from Cardinal to Criminal Justice Services.
All right, so moved, Mr. Chairman.
Okay, moved by Commissioner Leak. Is there a second?
Second, Commissioner Harden.
Okay, moved by Commissioner Leak, seconded by Commissioner Harding. Roll call vote. Commissioner Cotham.
Aye.
Commissioner Fuller.
Aye.
Commissioner Harding.
Aye.
Commissioner Jarrell.
Yes.
Commissioner Leak.
Yes.
Commissioner Powell.
Aye.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough. Commissioner Scarborough.
Aye.
Okay, and the chair votes aye. Madam Clerk.
The motion carried unanimously.
Okay, and the final pull consent item is item 6092, budget amendment, Health Department, revenue increase pulled by Commissioner Lee.
Yes, and thank you. I'm asking the question, will those funds be asked of the state or will those funds be asked from the federal government?
These funds are from the federal government. They're Center for Disease Control's dollars that are flowing through the state to the county for surveillance, epidemiology, laboratory capacity, infection control, mitigation, communications, and other preparedness and response activities related to COVID-19.
Will there be added staffing to this?
No, no additional staff.
But yes, we'll need the money. So moved, Mr. Chairman.
Okay, is there a second?
Second, Fuller.
Okay, moved by Commissioner Leak, seconded by Commissioner Fuller. Roll call vote. Commissioner Cotham.
Aye.
Commissioner Fuller.
Aye.
Commissioner Harden.
Aye.
Commissioner Jarrell.
Yes.
Commissioner Leak.
Yes, yes, yes.
Commissioner Powell.
Yes.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
The chair votes aye. Okay, that completes our consent agenda. We'll move now to commissioners' reports. I will remind you again, this is an opportunity to simply share information, not the time to make motions or ask for other action items to take place. We have originally said 3 minutes. I know that some reports might take more than 3, and I don't want to cut anybody off, but anybody who's making a report has up to 5 minutes, but that is the max. Okay, we'll start with Commissioner Cotham.
Well, thank you, Mr. Chairman. I won't take that much time. I just want to say how impressed I've been with our community, how people are concerned about other people, and people want to comply and they want to stay safe and keep others safe. And I've been so proud of our businesses, how they have really tried to make customers feel safe. And it's just, I feel like our community has really risen up. And even the people who, those of our neighbors who want the shelter in place to end, they still want everything to be safe and considerate. And I've just been really proud to say that I'm from Mecklenburg County. Thank you.
All right, Commissioner Fuller.
Thank you, Mr. Chairman. Just a couple things. First, I did neglect to say earlier that I congratulate Michael Bryant on his new position as an assistant county manager. Well deserved. I don't know what we're going to do without Mark Foster, but I know Michael Bryant will step up brilliantly as he has done throughout his entire tenure with the county. So I want to make sure to add my voice of congratulations to Michael Bryant for his promotion. The second thing I want to mention is that what this coronavirus has revealed are the existing disparities in our system. COVID didn't create them, it simply revealed them. And what it revealed was how much need there is in our healthcare system. It has revealed how we have, as a country, failed to put together a health system that is responsive to the needs of more than 300 million people. The fact that the United States is now at the top, the very top of deaths from coronavirus in the world, at the top of infections in the world. And I doubt that anyone believes that this was simply a matter of coincidence, that what it reflects are disparities that we have allowed to persist for many, many years. And now I think it's high time for us to do something about it. And we can start at the local level by advocating for resources and attention being paid to people who too often have been left behind. I think we ought to consider whether we put together a committee to not only review our response to COVID-19, but also to get to work on what we can do to dispel or eliminate these disparities. And I know our health committee is working on these issues as well, but we've got to get some action to the extent we can do it on the local level. The other thing that's revealed is, as I think Commissioner Rodriguez-McDowell mentioned, is the failure of our federal government to be of help to us. We have been left too often to our own devices, whether it comes to trying to obtain equipment for our healthcare workers, whether it's resources for testing. Our federal government, unfortunately, has failed us. And we've got to do something about that. And I believe that we can start on the local level, but it's something that has to happen on the national level. And so I want to end on a positive note, which is that I'm so proud of our emergency management operation that has been professional throughout in every single way, has been responsive to our concerns that we hear from our community, who have served us so very well in this crisis. It could have been much worse in Mecklenburg County, much worse. But because of the professional and dedicated people we have staffing our county and our towns and city, we have not hit the worst that could have happened. And so I just want to add my thanks, heartfelt thanks, to our professional employees here in Mecklenburg County who have come together in an unprecedented way to really meet this pandemic with our best foot forward. And I want to continue to do that. And I know it's a lot of people are antsy. I get that in my own neighborhood. People come right up to the line in terms of complying with the order, but it's because, we are an active people. Americans are active. We like to be out and about, and we like to socialize with each other. And so I'm just grateful for people who have done their very best to comply with this stay-at-home order. It will end. This too shall pass. But we want to do it in a way that doesn't cause greater harm. And so I'm just very grateful to live and represent the more than 1 million people who live in this county. So thank you.
All right. Commissioner Harden.
Thank you, Chairman. I wanted to let the commissioners know that this week, Susan Rodriguez-McDowell and I met with the senior ombudsmans for the community, Cindy Engelert, Hillary Kaler, who's the ombudsman for Mecklenburg County's nursing homes, and then Lindsay Tice, who does the adult care facilities. And it was really a powerful conversation because I just wanted to share a couple of things that they told us. One is that, of course, they're not allowed, volunteers are not allowed to go and conduct their analysis of the nursing home locations. And that's one thing that really, that they understand it, but also they're profoundly worried. And so they've been making calls to a number of they have residents that they have relationships with, and they had some just general comments. One was that there's a concern that just inconsistency and a lack of testing that's happening in the asymptomatic residents in the nursing home and long-term care facilities. And so they have just a general, after talking to residents and staff and family, they're very concerned. And these are the people, by the way, when people talk about, you know, who's calling, who do families call? They call these ombudsmen. So they've been getting lots of calls from concerned family members and people who want to know, you know, how they can advocate for their families in these facilities. And the other thing they said is that they're just hearing that it's very inconsistent in terms of access to PPE in these facilities, and it can depend by shift. I mean, they might run out on the third shift. They might not have the the masks or the gloves they need, or depending on the facility. So because there's a big difference between nursing homes and adult care facilities, it's inconsistent how they have access to the PPE, and they're very, very concerned about that. And then the last thing is that there's just a critical shortage of, right now there's a shortage of CNAs and nursing aides, and many of them are working for multiple clients. And so, helping work through what's best for the clients in situations where you have CNAs and nursing aides that might, do a shift in a long-term or an adult care facility, and then on the side, they go to people's homes and help with individuals. And so, there's that concern about how that's happening. And so anyway, it was just a very powerful conversation. I was glad to be a part of it. And they are really hoping to have a greater role and voice in how, the community, how we help have better outcomes, have better health outcomes for our nursing home and long-term care facilities in the middle of this situation. So anyway, it was a great conversation, and I'm pleased that the health director and our county manager are going to be following up with them, because they really are experts, and have just deep relationships, and have a lot to say in terms of how we might improve the health outcomes for this group. So that concludes my report.
Thank you, Commissioner Jarrell.
Thank you, Mr. Chairman. A few things very quickly. One, I don't think I congratulated Michael Bryant, but I definitely would like to add to the chorus of congratulations and let him know how proud we are, and it's well deserved. And thank you for that. And also welcome to Dr. Washington. You've done a fantastic job so far. So I want to say that. The other thing is I appreciate Commissioner Powell lifting up staff the way she did. I know you speak on behalf of everyone, so I won't go down that road too far, but I definitely want staff to know how much we appreciate them and their efforts. And also to our community. There's so many people out there that are selflessly sacrificing on behalf of our most vulnerable, and they don't get public accolades, but we're certainly grateful for them, their hearts and their spirit. The bulk of this report, though, I want to bring some information to my colleagues around the COVID-19 Response Fund. And I'm a member of the Funding and Grant Making Committee. And if you all remember, this is the fund where we as a county contributed about $1.3 million to this fund. And the Response Fund, it's actually a partnership between the county, city, corporations, the foundations, the faith community, and others. And it's actually administered by the Foundation for the Carolinas and United Way of Central Carolinas. And what we've been able to do is really the whole goal is to fund organizations that have the capacity and proven ability to really make a dent in this response. And so the thing that I'm most proud of, and we've been intentional about trying to identify grassroots organizations as well. So it's not all just the usual suspects that obviously have the infrastructure and capacity, but grassroots organizations that have been on the front lines, but often overlooked, particularly when it comes to funding in those community-based entities. And we've had a real focus on that. And I appreciate the committee members for having that focus. And the grants committee, it's an extremely diverse group in a lot of different ways. If you look at gender, race, field and function, it's extremely diverse, and the discussions have been fantastic as we've gone through and tried to identify those organizations that we feel like will provide the best relief during this pandemic. And so the fund has raised so far about $16.5 million. We've actually awarded about $6.5 million out of that 16. And so there were 2 dates. We directed grants on March 24th. And those were to more traditional type organizations, crisis assistance, social serve, Second Harvest Food Bank, Men's Shelter, Loaves and Fishes, Ada Jenkins, were some of those entities that received grants during that first round. And there was a second round that took place on April 9th, where we awarded additional grants. And, just some of the things that go into as we're reviewing these grant applications and trying to figure this out, we're looking at diversity, in terms of geography, a need, organization, the size, the population served, the partnerships, innovation, and really capacity, like I stated earlier. And so the second round, we had about 173 applications and awarded 51 grants at that time. And so it was broken down. Out of the 3 million, we were able to award in the areas of education, employment, emergency financial assistance, which is huge right now. Food security, it continues to be a major endeavor. Health and mental health is huge as well, and shelter and housing were the major categories. And so we're going to continue to focus on meeting basic needs. This fund is really about helping individuals, not standing up organizations. So I wanted to make sure that everyone had visibility to know what's going on with this particular committee. And thank you for allowing me to serve.
All right. Thank you, Commissioner Durrell. Commissioner Leek.
To the staff of Mecklenburg County, if you could see me, my hand is over my head. Mecklenburg County at the top, in the middle is the city, and at the bottom is the school board. So we are standing supporting our people who are the best in the country. The second thing is Mr. Bryant. I remember meeting that young man when I first came on the board, who was knowledgeable and helped me get through some processes that I needed to get through. Even today, I've been struggling with our loss of our worker who worked on the 11th floor that has been with me and talking with some of the family even today. She was almost like a daughter to me. So that is still in my cross. I'm still dealing with that. But as I look at the food desert and look at the problems that we have, when we talk about the problem of poverty, and we know what the problems are. We know what they are. So we need to stop talking and do something about them. And I thank you for the vote that we took, which was 6-3, that our manager will do what she can in inviting those personnel who will come and talk with us and say to us what they can do or cannot do. And yet we issue them the right to build in our communities, but yet we do not hold them accountable for what they need to do for the community. My seniors, I love you. Think about you, talk with you. There has not been a day that I have not talked to at least 5 or 10 senior citizens in this community, not just in my district. And whatever I can do, I will do it. Talking with people about the schools, people are very much concerned about some of the communities which have been neglected in the process of receiving the food or changing the sites for the children to pick it up. Had to talk with the superintendent about those issues. So we're dealing with some major concerns, and I would hope that we would meet with the school board, the body as a whole, and not just the manager and the chairperson. No disrespect, but I'm saying we are the ones who need to talk with them, and they need to talk with us. One thing good that came out of this is made us stay home with our families, those of us who have families. It made us know different ones better. Our children know each other better. We've talked about this. So out of every negative comes some good, but I'm worried about how this came about and the people who suffer the most because of it. Was that a sign, or is that a sign to get rid of some people who are brown skinned when they said that America was going to become brown? Or are they saying we have to find a way to get rid of them? I'm not sure, but I hope that that's not true. So I say to us, let's continue to pray, do the right thing for all people, and respect each other, and especially women and men respecting women. Thank you. God bless, and good night.
Okay, Commissioner Powell.
Hello. I want to take this time to make sure that the tennis community knows that, because I've heard from so many, and I'm glad you mentioned that, that the United States Tennis Association came out today with some protocols, and that every email that I've gotten, I've sent forward for consideration. And so we are on, so the tennis people know we're on it. And I don't know what the resolution will be, but your voice matters. And then also the real estate industry, I'm still hearing that some of the people are not following the state of emergency guidelines, and I've encouraged them to call the hotline to report that. But it is a concern of many, especially when they had, I think, 58 new listings yesterday, and it looked like some of them had professional photographers come into houses that were where families lived. There's a big concern about that. The hardest, it's hard to be an elected leader at this time and to get all the telephone calls that we're getting. It's very hard. But some of the greatest anguish that I've heard from people are small business owners, and probably, really small business owners, and probably micro businesses. And I just want all of the small business owners to know that we care. We care about you coming back into the economy. We want you to do it safely. And I'm not a loud person. I don't seek the limelight. I am a deep thinker, and I'm doing my best to make sure that all of your concerns are communicated. But make no mistake about my quietness. I am very strong, and I will be advocating for the safe return of small businesses. I just want us to do it the right way. And I have one question for Gibby. If someone in a nursing home tests positive for this COVID, are we moving them to a central location, or do they stay there? Because I have a person who's concerned about Huntersville Oaks.
So here's the situation. Huntersville Oaks belongs to Atrium. And Atrium has chosen to cohort, they're calling it cohort, all of the COVID positive individuals they have in their other nursing facilities at Huntersville Oaks. They've cleared out one of the wings in that facility. They feel like they can better care for people there, and they can isolate them better there than keeping them in the facility where they currently are if they've tested COVID positive. So yes, they are moving individuals into that wing specifically, not into the rest of the facility. They're the only ones at this point that I'm aware is doing that.
Okay, so in other facilities where they might have a positive, they just stay in an isolation room?
Yes, they, and what we're working with the facilities on is how they can best isolate. So how they can, they may move some people around a little bit to make sure that the folks that are COVID positive are better isolated. And most of them are doing a really good job of that.
Okay, I thought I heard the buzzer.
Oh,
yeah.
Well, dang. Okay, well, thank you. That concludes my comments, I guess.
All right, Commissioner Susan Rodriguez-McDowell.
Thank you, Mr. Chairman. I wanted to echo Commissioner Fuller's point about how just really recognizing the gaps in our systems, how this crisis has revealed those gaps. And I think if we can do anything that makes us come back stronger from this, like for one thing, maybe if Medicaid expansion becomes even more obvious than it already is as a move for our state to make, I hope that is even being considered because we can see what a failure our health system is. And not that would even fix it, but it would be a step. I also wanted to just mention, I didn't get a chance to make a comment about the proclamation for the mass shooting at UNC Charlotte. And I just wanted to recognize our chancellor and the professors who, the staff, UNC Charlotte, who cared for students through those dark times and just recognize how they made a difference in those students' lives. And also just wanted to shout out to those students, what a year they have had. I mean, to go from a mass shooting one year to a global pandemic the next year in your college career. I mean, it's just, I hope it's building resiliency in our students. And I just, it's not lost on me what a tough year this is for so many, but just highlighting the students at UNC Charlotte and other students as well. And I also wanted to just say that one of the things I'm really trying to get my head around is our loss of jobs. When Commissioner Hardin has been asking about the unemployment statistics for Mecklenburg County, I've really been interested to try to learn, exactly how is this crisis affecting people in our county. And so we know that there are people who can work from home and it's not a huge loss for them. It's a loss of inconvenience of doing your favorite activities maybe, but it's not a loss of income for some people. And so I would really like to know if there's any way we can, figure out sort of how many people are being affected by loss of income. And so one of the things I was looking at was the CRBA came out with a number of 71,000 jobs in our region, which have been lost, which is, they said 4.8% of total jobs. And then the state unemployment number, I believe, was 230,000. And so just trying to reconcile those numbers and what it means for our county. I've also been inquiring with our food banks about, what does it look like? How many people are lined up for food, for emergency food help? I reached out to Loaves and Fishes just to try to, give me a number. How does it look different than the months before COVID struck and also last year at this time? So the pre-COVID weekly number was 1,200 people served. And during this time, it's 3,500 per week. So, and then if you look at last March, 2019, it was 4,167 individuals served. This March, 9,304, which is a 123% increase. So this is just Loaves and Fishes, right? So it's not speaking to the total crisis of emergency food help. But I'm just putting that out there as, you know, if anybody has more information or I just want to highlight that this is just going to keep getting worse. More people are going to need emergency food help as our days and weeks go on. So let's just keep that in our minds of how we can be a part of helping that situation just as individuals. And lastly, I just want to say thank you to Commissioner Hardin for her update on the long-term care facility conversation that we had with you on budget. I'm sorry. Thank you.
Sorry. Okay, I didn't hear it. My apologies. Commissioner Scarborough.
Thank you for the opportunity. I appreciate all my colleagues and the information that they have been given. I also wanted to talk about that COVID-19 and some of that. I know our church and some other churches, I'm sure all of them are participating in making sure that people are getting, one, fed, and two, getting their needs met. So I think that Mecklenburg County, let me say it that way, Mecklenburg County is on the right track. And we do it well. Sometimes we have a little niche, but most of the time, yeah. So I thank my colleagues, each one of you, for what you're doing. And I also thank my chair. Thank you, Mr. Chair, because you keep us on the up and up. So I think that for all in all, we're doing well. I just don't have any other things to say other than that. And I appreciate being a part of this wonderful group. So have a good night.
Thank you. Let me first start off by thanking my colleagues. I know this is difficult for all of us, but you guys have really been thoughtful and deliberate, and you have demonstrated that you really care about all segments of this community. And I could not have served with a greater group of people. So I want to thank you for your thoughtfulness and your willingness to do the right thing. I want to also congratulate Mike Bryant. Well-deserved, well-deserved, well-deserved. I also want to thank Mark Foster. Hopefully we'll still get an opportunity to thank you more appropriately at another opportunity. But Mark has been a godsend for Mecklenburg County. His understanding of the finances and stuff like that has really been a blessing to me. So I want to thank you for that. I think I heard in a report earlier tonight that Atrium stepped up and made some masks available to the homeless. If that's what I heard, thank you, Atrium, for your contribution. I know that there are others who can step up and make masks available to those who might not have the means of doing so. I heard that expressed throughout tonight's meeting about people who can't afford to have masks. I would love to be able to ensure that everybody who wants a mask can wear a mask, but I will tell you that I wear one when I go out in public. I'd like to see more of them. I've seen demonstrations that demonstrate just how effective wearing the mask is in terms of spreading the virus. So I hope more of you will be diligent and wear the mask when you're out in public. I don't think we've done our job until everybody who wants to be tested or needs to be tested can be tested. And I think the federal government has a responsibility in helping us to ensure that happens. And so while I'm not going to bash the federal government, I think we deserve more. And I am looking forward to that assistance in making sure that everybody who wants to be tested or needs to be tested can be tested. I also want to make sure our community understands that even before COVID, if there were need for services offered by the county, they are still available to you. So somebody who may not have been eligible for food stamps prior to COVID might be eligible now. I don't want us to forget that those services are still available. And so if you have need of those services, make sure that you contact the appropriate department and get your needs met. Lastly, I can't say enough to the staff, those that are working, those that are at home, how much we appreciate the services that you provide to the citizens of Mecklenburg County. You make it easy to do our job. And I just want to say thank you. Thank you to Emily and Tyrone and our county manager for getting me straight with this agenda. I think it went a whole lot smoother tonight, and I hope we will again in the future. But I look forward to the time when we can all get together and meet again. So with that being said, is there a motion to adjourn?
So move.
Second.
Moved by Commissioner Fuller, seconded by Commissioner Susan Rodriguez McDowell, third by Commissioner Harden. And I know this is tedious, but we still got to carry out the roll call vote. Commissioner Cotham.
Aye.
All right, Commissioner Fuller.
Aye times 4.
Commissioner Harden.
Aye.
Commissioner Jarrell.
Yes.
Commissioner Leak.
I made the motion. Yes, Lord.
Commissioner Powell.
Yes.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Yes.
And the chair votes yes. Meeting stands adjourned.
All right. Have a good night.